5-step action plan. And the model we are using, remember, it is across the world. So this is the same model that is used every other place for mental health first aiders. Then lastly, where to turn for help. Where to turn for help. Sawa. So nimejaribu kuiweka in the simplest way possible. I'm not a medic, I'm also part of the training. So I'm also here to learn. Sawa. So I want us to introduce ourselves. And when you're introducing yourself, tell us about you and where you come from. So, where you come from and your expectation, now that you know what we are going through. Tell us what you wish to have at the end of the day. So, and be audible as possible so that we don't keep wasting time. So we can start from the reflector guy. Good morning.
My name is I'm a member of YMCA. Media team here.
Thank you. It's just put manners to black. Thank you. Good morning. I'm Lisa from Masada. I'm here to learn more. Thank you.
My name is Gentina from Masada. The expectations are to learn about mental health and help one when helping them.
Thank you.
Good morning.
Good morning.
I'm a member of YMCA. And recently, I was in a project for EFF, and I'm delighted to learn more.
Thank you.
Morning.
Good morning.
I'm Fidel Castro. I'm also a member of YMCA. And I'm here to gain more knowledge about mental health.
Thank you.
Good morning. Good morning once more.
Good morning.
I'm Adeline Mukasia. I live in Nalenda, Kawata, but originally from Kakamega County. I'm a student at YMCA, and by the end of the day, I know I'll be able to acquire the knowledge and skills so that when I get out of there, I can be the hand to the community.
Thank you.
Hamjambo.
Hatujambo.
Jina langu ni Emmanuel Omea. Mimi ni member wa YMCA. Kwa hapa ili kusikia kitu na nitoke na kitu na niende nifundishe. Asante.
Thank you. As we continue, remember we are live. So ukiendelea kujiongelesha, shauri yako. People are seeing you outside there and they're wondering what kind of participant is this. So it's good to be sensitive. Nawaeleza mapema.
Good morning.
Good morning.
My name is Phyllis Okech. Currently, I am an intern in Kakamega, practicing psychology, and I'm eager to learn more on mental health because it's my practice.
Thank you.
Praise God.
Amen.
Good morning.
Morning.
My name is Vincent Kareji, first year tailoring and dressmaking. I'm currently in Kisumu, but I'm from Kakamega County. I'm very glad to be here today, and by the end of the day, I'll be very glad to come out of this place being mentally well and being mentally empowered to help other people outside.
Thank you.
Good morning, everyone.
Good morning.
My name is Shari Alejo. I am a student here, I'm an electrical student. And I'm here to learn in the choir knowledge so that I will be able to help people out there.
Let's go.
Amen.
Let's go again.
Amen.
My name is Amanda Mambo, HOD Dressing and Beauty Department. I'm a lawyer, both an introvert and extrovert. Those are my characteristics. I can be a sanguine if given opportunity sometimes. That is the way I have different three characteristics. And I would say I'm here today to be empowered more in the issues of mental health because I deal so much with young people and I want to know more on how to handle them, especially with mental issues and even the community outside there than we need.
originally I'm from Kenya. I'm glad to be here to learn more about mental health. And what makes me proud also more to be here is that almost all of us we are patients of mental illness. And by the end of the day, at this training, we are going to be doctors to ourselves. Then go again to be doctors of other people, and we are going to have the same. Thank you.
Thank you.
Good morning.
Good morning.
My name is Isaac Dina. I'm a member of the YMCA. I'm a plumber. I come from Nyalenda, but currently where I stay. But my original home is Homa Bay. So I realized from where I came from, starting from Homa Bay, there are so many widows that are being affected mentally after the death of their husband. So when I go back there, I will learn more here on how I can encourage them on the issue of life. Then where I come from, Yalanda, there are so many people that are addicted by drugs, and these are I can say these are the things that are not all right, that affect their brain, how they are functioning. So I may up from here, I may up this really one there. Those are the issues.
Thank you.
Praise God.
Amen.
Praise God.
Amen.
My name is Grace Azekara, project student at YMCA. I come from actually Nyanza region, Kisumu County, Kisumu East sub-county, Kajulu Wada, Bukuna village. And from the training that I'm about to acquire and the training that I acquired before, because I'm just here to get more impact on it, so that when I go back to my village and even to other schools that we often visit as youth, we got a group as youth calling itself KYC, Kajulu Youth for Christ. So we will be able to mentor people and other youths on mental health and tell them how to manage their stress when they're back there. Thank you.
Thank you.
Good morning, everyone.
Good morning.
My name is Vinia Wino. I'm a member of YMCA. I volunteer for Kisumu YMCA. I'm also a trained mentor at YMCA. I'm a resident of Homa Bay County, a place called Uyumbis, village called Kawino. I'm currently staying in Kisumu, and anytime I visit the gate of YMCA, I always feel proud because of the people I meet inside. There are people who will never do something wrong, and they just let you. They will always correct you. But youth, let's don't just be people who are being corrected every day, every time. Always being corrected every time and every day. I later realized it's not a good thing. It's just a song that has been sung every day. It will not change my life. But when I sat down and realized why I'm being told this each and every time, it's affects me mentally. So when I'm here today to learn about mental health, I really thank God for this training. And let everybody who is leaving this place to have a change and be able to facilitate what will be told in here outside. Let's be proud of ourselves. I will continue being a member of the Form of Change. Thank you.
Amen. Thank you.
Good morning. My name is Sarah Sofa Mahingi. I'm a student at YMCA Kisumu, pursuing cosmetology. I'm a Korean from Korea West, and I'm glad to be here today because I've been able to learn more about mental health, and my side of it is just me because I know that I have been going through a lot of challenges, and I think even me somehow I have a problem on this side of mental health, and I believe that at the end of the day I'll gain more knowledge about mental health and how to control it. Thank you. Good morning, everyone. Good morning. I'm Crystal Watch, a student
YMCA, pursuing mechanic course from Molugis and staying in Kisumu at Negotiate State. But I'm really proud of today to be among you for this training so that I can help myself first. So after helping myself mentally, so I can go out there and help those who are in need also. Thank you, Lord.
Thank you.
Good morning, everyone.
Good morning.
Good morning, once again.
Good morning.
My name is Alex Omondi Onyango. I'm a new from Kajulu in Kisumu East. I'm so much happy to be standing before you here today because this is a great opportunity to me personally, and I bet it is also a great opportunity for you because we are here to learn about mental health. Because mental health nowadays is a big problem. In fact, one of the quotes from Ipso, mental health is a very big problem. And through sharing and being close to each other, it's a great thing to welcome this healthcare mandate. Thank you.
Thank you.
Good morning.
Good morning.
My name is Elizabeth Adiamo. I reside at Navasaria. I'm a member of YMCA, a level 6 student at Commonwealth College. And personally, I'm here because, one, I want to know more on mental health, and finally, I want to get to become a mental health first aider and give out mental health facilitation to those who I think deserve it. And I'm sure by the end of it all, we would have understood each other and got to learn more. Thank you, and I wish you well.
Thank you.
Good morning, everyone.
Good morning.
My name is Maureen Shantu. I am a proud alumni of YMCA Cosmetology Department. I am also a peer mentor, a beneficiary from a YMCA program called YMCA. And my expectation today is to learn more about mental health, to be able to help others, and also mentor others in terms of mental health to just make the world a better place. Thank you.
My name is Trama. By profession, I'm a mechanic in charge of automotive department. By calling, I'm a pastor and also run a program. And I head for the accounting, that is my area. Otherwise, I just want to thank God for this program. That I know I'm going to be equipped so much because I normally facilitate young people every class, everybody have a mental health class. So he is going to add knowledge so much on us. We are going to be so much effective at YMCA, at our church, because we normally focus most on the spiritual aspect of it. But we are able to do it kind of people have a mental health problem in the society. Otherwise, thank you and God bless you.
Thank you.
Good morning, everyone.
Good morning.
My name is Silas Wendy, a member of YMCA and a media team of YMCA. Thank you.
Thank you. Let's clap for ourselves. So without wasting time, it is 9. So on the program, immediately after the first facilitation, we will have a 10 o'clock tea. Then come back here. I don't know how the facilitator will take us, but immediately after lunch, we expect to be almost done or done. Then we'll do the certification immediately after lunch. Is that okay?
Yes.
Yeah. For those that are not members of the YMCA, you can always talk to somebody around you. And I would wish that we mix. Tuanze kumixa hii kabla facilitator akuje. So that the Jamasarias can mix with the YMCAs and tell them about the YMCA. I don't want this kind of sitting. So she's tusimame tufanye haraka tuache question time. Many can sit with us straight. Fanyeni haraka we are actually tungekuwa tumesonga. I don't want this here. Move, I want a YMCA. kuangalia simu, nikiona iko too much nitaleta basket. Sawa? But nikiona tuko mature enough, we are not concentrating so much on our phones, it will not be necessary. Otherwise, thank you so much, feel at home. I want to now introduce our facilitator. She's Lillian. Lillian is from the county, Kisumu County Referral Hospital. And she's here, and I know her colleague will be joining her later. So they are the ones in charge of mental health in Kisumu Central Sub-County. And I think she'll talk about herself when she comes here. I know I've not done it so well, but she'll introduce herself better. She's a mother, the way you see, and her age tells you she's been in this field for so long. So she'll tell us what motivated her, because maybe those days mental health was in you. She'll tell us the journey and her experience, then she'll also take us through the topics. Tumkaribishe kwa makofi.
Thank you so much, Madam Pamela. I want to appreciate being here. My name is Lillian Okonjo. I use all those names because I want to make the men in my life. So my husband is a money. So I didn't want peace. I brought them together. So I use all that. And I just want to appreciate all of you. From the way you introduce yourself, I felt so happy. When you have your identity, don't be ashamed of your identity. I am so and so, I come from such and such a place, and this is me. So I appreciated that in the first place. And then in the second place, I appreciated a team that is accepted that mental health is part of health, and they are ready to walk the journey of mental health and break the stigma. Mental health has always been a part of health. Health has three cornerstones, but mostly we focus on the physical. When we talk about the mental, we start myths and misconceptions, we start putting issues inside, and then it behaves like mental health does not exist, but it does exist. Why did I train as a mental health personnel? Currently, I'm a physical registered psychiatric nurse, and proudly one. I trained in mental health because I did not understand myself first. I used to get irritated over things, so irritated that I want to burst into tears. So I asked myself, why am I getting irritated? Am I the problem or are they the problem? Is society the problem or am I the problem? So I realized I had to find me first. So finding me, I had to go and train somewhere. The first person to tell me not to train was my mother. And when your mother tells you not to go and train, you go and train. Your mother, not anybody, my mother. She said, if you go and train, from the way I'm seeing, you're going to be mad. And because I don't want you to be mad, don't go. But I always kept insisting. The worst bit is that when I joined the training, that is the year my mother died. So I always ask myself, oh, should I not have gone? But I said, no, she had to die because I had to die. So what I'm trying to say is that I had a passion for mental health from the word. I wanted to understand me. After that, I understood me. I knew my place in society. I knew my strengths and my weaknesses, and I walked the journey of issues mental health. It has not been an easy journey because the community puts a lot of stigma on mental health issues. When you start saying, oh, I'm a psychiatric person, a psychiatric? I said, but no, we are not talking to medicine, we are talking me and you, finding a balance in life, finding your space in life, just accepting that this is me and this is where I fit in. So I appreciate having done mental health, but above all, I appreciate you people coming on board. Though it has taken a long journey, we've never had policies in mental health. We've never had opportunities in mental health to even talk about it. We've never even looked at mental health of the clients that we attend to. We were never given an opportunity. We put the hospital, kuna shida gani? Kidonda. Sini kidonda. But we are not saying, how did this kidonda start? Could somebody be at home who beat you to bring this kidonda? Or could you have harmed yourself for the kidonda to come along? Are you getting me? So nobody was bothered about your mental health status. All we did was the physical health. Akona shida gani? Akona shida fulani. When you come to the hospital, nobody wants to know who you really are. We want to know who you are because of biodata. Oh, tunaona clients wangapi na wanaitwa nani. But nobody says, Jane, I know you are unwell, you have come to the hospital, and Jane, you are going to stitch your leg, and it's going to take a little bit of pain, but in the meanwhile, utavumilia, tutakudunga shindano ya uchungu. Does somebody walk you that journey? Why does somebody not walk you? Because nobody puts emphasis on mental health, the mental health of the client. You can be in pain, but you need somebody to walk that journey with you. You are in labor. Oh, hello, Anne. You are in labor. Yes, okay, fine, it doesn't. But when somebody walks the journey with you, I can see you are in labor. This is a process. People undergo these processes. But currently, we have examined you. We have found you are 1, 2, 3, 4 senior. And when we have found you 1, 2, 3, 4, maybe in the next 4 hours, if all goes well, you're going to have your baby. You're going to walk through the journey of pain. The pain is umbilical, it is physical, it is there. But I am here for you. I will walk the journey with you. Do we always do that? Because we didn't look at the mental aspect. We assumed, these are drama zitaisha. So nobody wants to walk that journey with you. Even the ministry was not ready to walk the journey. If you talk, like you're wasting time. All they ask is that. Nobody wants to know. When she conceived, did she conceive knowing? Did she want this baby? And even after she has gone through the pain, does she still want the baby? What is her story? Everybody has a story, see? But nobody, who wants to hear their story? Nobody. We want data. We want skilled delivery. How many skilled deliveries? 1, 2, 3. No. You are not doing fine. You have a catchment population of this number. For your catchment, where is the CHP? Nobody wants to know how that journey was walked. So I want to deeply appreciate you people coming here to be ready to talk issues, mental health. I appreciate it. Because all, at the end of it all, mental health is one of the 3 cornerstones of health. So I appreciate you all. We have also started working with the entities of having policies on mental health. So I appreciate our government also for appreciating that there is mental health. Thank you.
So as she prepares, I've seen some 2 people walking. And I guess yes, I need to do this.
Good morning, everyone. Good morning. My name is Mercy.
So why are you here?
No, I'm here for the first education.
Thank you. Any other? So nataka kuuliza jirani yako kama anajijua. Tumesikia Mzee akasema she was really functioning with herself. She really wanted to know herself. Sindio? We could be here and we don't know ourselves. Sindio? Tumesimama tu tumevaa glasses, tumevaa t-shirt, isn't it? Yeah, so it is important to know who we are first before we match the same to others. Yes.
I will appreciate active participation. You have gone through different experiences. So I cannot be agreeing on issues methodology. There are some things you have gone through, I've not gone through. There are some things you have seen, I've not seen. So I have active participation. So that way we build each other. See? So let us not confine ourselves, let us share. So the topic is mental health. But before we go into mental health, we have to ask ourselves, what is health? Health is a state of physical, mental, and social well-being, and not merely the absence of disease or infirmity, as defined by World Health Organization. Do we feel it's okay that way? We agree with World Health, we can always refute it. Does health encompass everything when it talks of physical, mental, and social well-being? It's a state. A state is hali. A state. Because state gani, I'm in this state today, I'm in the state of. So it's a state of physical, mental, and social well-being. In health, they put a lot of emphasis on physical and left the mental state behind. The next step is wellness. Nowadays, we hear institutions have been opened. It's called an institution of wellness, mental wellness. So what is mental wellness? Mental wellness is about prevention, coping with life's adversity, and being resilient when we face stresses, worry, loneliness, anger, and sadness. That is by global wellness. When you talk wellness, you talk about your resilience, your ability to withstand. You can be 5 brothers or 5 sisters or 5 siblings in a home, and then a catastrophe occurs in your home. Every individual will have their own resilience to withstand this catastrophe. Is that true? Like if you lose your parents, there will be those who say, they were meant to die. He educated me up to this level. At least I can fend for myself. But there are those who will remain stagnant there and say, why did it have to happen? Why this time? I can't move on. And yet, life demands that you move on. So it is your resilience that will bring you out. Sour. When things go sour, when a relationship goes sour, we have a lot of relationships. Brother, sister, father, mother, teacher, student. When a relationship goes sour, what happens? Do you get stuck there, still waiting with the door open? Or do you clean your house, start afresh? When your relationship with your brother breaks up, you banked on him, depended on him, your education was all about him, but suddenly he's no more. What happens? Do you go to his house and take his properties and leave now you are moving on or what happens. It depends on your resilience, how to deal with your loneliness, your anger, and your sadness. When we walk the journey of life, there's a lot of sadness. There are a lot of stressful issues that come our way. How do we deal with them? That is what mental wellness is all about. Coping with life's adversities. Mental illness. We talked about health. We have talked about wellness. Now we are talking about mental illness. People use these words interchangeably, or sometimes to mean one and they're saying another one. Mimi niko na mental health. Niko na shida ya mental health. Unaweza kuwa na shida ya mental health kweli, utakuwa na mental illness, si ndio? But people tend to use them interchangeably. So when you're going out into the community, it's good that you know those differences and talking about. So mental illness are health conditions involving changes in emotion, thinking, or behavior, or a combination of these. Mental illnesses are associated with distress and or dysfunctional in social occupation or family setups. Do you believe in this? When somebody is mentally ill, do they think the right way? They have a problem with the way they think. Are their emotions okay? Because if your emotion is okay, would you kill people that you love? Would you commit homicide? No. Would you commit suicide? No. So it means their thinking and their emotions are not in tandem. Mm-hmm. And then their behavior. Their behavior conform to society. There is a societal behavior that we have. We expect you to behave this way. But when you have mental illness, then your behavior becomes different. When you lock yourself in your room for one month or even 2 weeks, is that okay? You have to come out and socialize. Hata kama tuko na matanga nyumbani, tunaitana bedroom dakika kidogo alafu tena tunatoka nje. But ukikwama kwa hiyo bedroom ukatae kutoka nje, is it a normal behavior for the next 3 days? Utaki chakula, utaki kufanya chochote. It means that your behavior is now not okay. If we talk about health, mental health, after wellness, and so we talk about mental health. What is mental health? After mental wellness, what is mental health? Mental health. I was going to come and talk about mental health. So what is mental health? This is a state. Mental is always a state. A state of well-being where individuals recognize and realize their abilities. They're supposed to recognize and realize your ability as an individual. Can I do this? Is this my strength? Is this my weakness? Are able to cope with the normal stresses of life. Life has stresses. Even those who live in Eleshwa, in Bani, they have their own kind of stresses. So life is all about stresses. So can you deal with these stresses? And how you deal with these stresses is it. So it is cope with the normal stresses of life, work productively. We are at the age of working productively. We work productively. What we do, does it add value to society? Are we productive and fruitful? So those are the questions you should be able to ask yourself. Not the question saying, serikali haijatupatia kazi. We are saying work productively. Kama ni kufuga kuku productively. Kama ni kushona nguo productively and fruitfully. Kama ni kutengeneza gari, tengeneza productively and fruitfully. Sawa. But when you keep every day complaining and you are growing older, for how long will you complain? It reaches a time when you realize, I thought these days were going to be growing. I thought these days were going to be but from the look of things, so it becomes your turnaround time. See you? Are we together? Yes. It is not only, in fact, the government is never the employer. Their responsibility is to make a conducive environment. There is peace. They talk with partners, and partners come to invest in our country. So they are not really your main employers, but they make an enabling environment for you to work productively. So if somebody has not made the environment enabling, that is where you can say the environment is not enabling. But despite that, we still expect you to do what? Work productively and fruitfully and make a contribution to your community. You are given a chance to write your story. What will you write your story? This is why I'm equal. So maybe I'm why I'm equal. And you have gray hair. Who are you telling? You're telling your child. Does your child know that you were never employed? Your child knows you are like, after the child will get surprised, that's it. Understand? Are you getting my story? Yes. That I'm saying, yes, if there's an opportunity, get an employment. And say thank you, Savior. But if the opportunity is not there, create the opportunity. Create the opportunity and work productively and fruitfully and make a contribution to your community. Everybody here saying, I come from here, I come from here, I come from here. What can your community say about you? Watasema nini ukirudi nyumbani, ule msichana ya fulani, ule kijana ya fulani ni nani? You have a chance to write your story. So you contribute to your community, productive and fruitful. We've talked about illness. Is there any concern up there? Mental wellness, mental health, mental illness. Wellness is prevention. Health is finding a balance. Illness is abnormal behaviors and thinking.
I have a question.
Yes.
Yeah, I'm just wondering from your explanation. Does it mean that in this country we are all mentally ill? There's a mental health problem because it's like everybody's on the streets. We're asking the government for employment. We are saying they need to provide jobs, and we are telling us it is us who are supposed to be more creative, create the jobs for ourselves, so long as the government makes the environment enabling. I don't know.
Do you feel we are that we have a mental issue now that we cannot become productive? We keep asking Silikali to andike.
Yes. She's right.
Right.
Yeah, because nowadays, mostly the youth, we take like the whole day running down the streets. Instead of that little time, you can go back and do something, even if the little amount you have. Instead of going every time shouting,
So is our mental state one thing?
Yeah, it is.
We are not ill, but our mental state is one thing.
Yeah.
I think I understood that the government is providing the inclusive environment, whereas we try to be creative with our own means of earning. The question is that the government will never to create that conducive environment.
I don't
Always start blaming us.
We are all Kenyans. I don't know if the government has created that conducive environment. We feel it has not.
It hasn't.
It has not. But that notwithstanding, life goes on. You see, that notwithstanding, life goes on. That notwithstanding, life goes on. You have to eat, you have to bathe. When in your growth and development, at some point you have to interact with the opposite sex and marry, and bring forth children. So for how long will we wait for this enabling environment to come before we move on? That is the question. But enabling, not enabling, I leave it all to judgment, but I say, within that confusion, find your space. Are we together?
Yes.
Within that confusion, find you. Within all that, it will find you. Sawa.
Yes.
Are we together? So we have factors that influence our mental health state. Factors that influence our mental health state. These are just examples of those factors. Those factors are so many. I want to believe some of you have more in your analysis for this. Factors influencing mental health. So your mental health to be stable. There are factors that influence. Many factors, that is social, psychological, and biological, are going to affect mental health. Limited social support or connections. Is it true? Limited social support or connections? Does it affect our mental health? When we have limited squeeze is a connection. So those are the things that irritate us. When you have more, I had some people say they are from different counties. When you come to live in another county, it is important that you have social connections. You live here, you are from maybe Migori County, you are from maybe Homabay County, you live in isolation, you do not have social support. If you have a problem, then it becomes stressful. So it is important that wherever we live, let us create that social support. You have friends that you can rely on. When you are sick, who will take you to the hospital? When you have financial challenges, who is standing with you? So it is important to have social support. You can get them from the churches, from the schools that you attend, but it is important to have social support. You cannot live there. I come from Homabay, I live in Kisumu, I don't go to any church, I don't go to any school, I don't go anywhere, I'm just alone. Then it brings mental health issues when things come your way, when challenges come your way. Alcohol and substance use. Factors influencing mental health. We agree that alcohol and substance use can influence our mental health. We agree it's a lot. When I talk to the youth, it's always a debate. We agree.
Yes.
We agree. Yes. Can somebody tell us how alcohol and substance affect our mental health? How? And you're from Kenya. Yes, and I know Kenya. So tell us alcohol and substance use.
Okay. Alcohol and substance abuse usually leads to directing of your income, part of your income, which you can use productively to enter into alcohol and substances. At the end of the day, you find that you can't find the right balance with your basic needs.
Economically it appears. Another one, we want to bring down alcohol today.
When we say alcohol and substance abuse influence our mental health, first, when you check alcohol, I tend to see the people that check alcohol, their way of thinking is not normal. They behave abnormally because I think alcohol triggers some unwanted behaviors that is in them. Yeah.
When you pump it way down there, see you and then pump it becomes another person and you become another person. Can we bring down alcohol and substance? Somebody else? We talked of the economic effects.
When alcohol, according to me, the way I understand, it's let me say it this way. Kuna venye nacheza na akili. Shakunywa pombe, unapata unatoa some much that has a perspective to your mouth, and you talk to people aimlessly, like see everybody is just you. You think that ukitusi huyu ni wewe atakuelewa, but it's also affect our mental health in terms of finances. Unatoka saa zingine uko na pesa. Ushaona mtu mwenye yeye ako tu sawa from morning, ikifika jioni anaenda kunywa pombe, hakuwa na pesa. Lakini utapata Umeelewa? Mtu kama huyo ataanza kushusha kwa nguo peke yake. Wengine hadi wanajikutulia. Hiyo pesa yenye hakuwa nayo, yenye ameenda akapata kakunywa na pombe, angeacha kwa familia yake, singesaidia familia. Hata you find ametoka ameenda kunywa pombe. Mama na mtoto hapo kwa nyumba wako njaa. It doesn't sound good, but it also affects our mental health.
Once you have become addicted, your alcohol and substance use also linked to limited social support and connection, because once you become addicted, you might find yourself that some people will be showing away from you. There's a person at long last, you are left alone, then become mentally unstable.
That's it. Say the social aspect, we also say the social aspect. Though they say also when they meet the alcohol, it means they don't social. Are they negative or positive social?
Okay, there are communication stages when they need. Yeah. Even their reactions change.
Their reaction changes. So alcohol interferes with the things that you said about them. The way you think, serious. Your emotions, serious. Your behavior, and the way you interact in society. You see, when you have a family, and then you're drunk, and then you can cook up and then you're exposed, and then you have your children. What do you think they're feeling? And what do you think others are saying about them in school? They will stop going to school. They will be told songs like, Baba yako, ananuka hapo. The child tells you, say, go to school. And they say, I'm not going. You think they are sick. When you insist, atasema, kichwa inauma. And you know you can't prove kichwa inauma ya mtoto, sivyo? Kumbe, ile behavior yako inamsumbua ama inamwaibisha shuleni, sivyo? So I want to believe it's not producing a lot of positive effects other than kwa mfanyabiashara wa pombe, but to us at individual level, at family level, because even the physical ailments that brings you to the hospital is alcohol. Si umeanguka kwa mtaro ukavunjika mguu, ukapata majeraha unakuja kushonwa, sivyo? I don't want to mention the diseases, the diarrheas that come with it, the skin diseases that come with it, the malnutrition. Yes.
Alcohol can mental health also, it also separates. Because unapata in a process, baba amelewa, akirudi kwa nyumba usiku, anagonga mlango, wanataka kwanza na mama, saa zingine anapiga mama. Wewe mtoto ukijaribu kuloa the kisirani chini, kisirani inazidi, mnatolewa na mama kwa nyumba. So inafanya familia mingi zina separate na inapatia watoto stress.
You even lose direction when you hear Kajirani that we are to I hear that you have been found sleeping in the neighbor's house, surely. Serious. So let us bring down this alcohol and substance use, because it distorts you. They are not you. Serious. And anything that distorts you from being you is a factor that influences your mental health. Violence, physical, emotional, and can violence affect our mental health?
Yes, it can.
It does.
Yes.
When you've gone through physical violence and maybe your face is distorted and your body image is distorted, even if you're walking in the street, you have this jamba that is covering this side of your head, or maybe you got a head injury, maybe you tried to beat your significant other na yeye pia kajaribu. Akisha kugonga kichwa si unavaa kofia. It distorts everything. Even the children learn that violence is an answer to everything. And is it really an answer? So we are bringing up a culture of violence. And violence can be physical, it can be emotional, and sexual. Can we also, I think I forgot one, it can also be financial.
Yes.
Financial violence. If you are a kazi, maybe you are a couple in the house, both of you are getting an income, and it is only one person who is taking these monies and using it in only ways that benefit yeye mwenyewe, or maybe benefits the family, but is not incorporated with it. socioeconomic pressures. And this goes to mental health issues. Socioeconomic. Kama una pesa kila siku, day in day out, si unachoka sana hata wewe. Si nakuletea malaria ya kichwa. Maana niambia when they come to the clinic they tell me niko na malaria ya kichwa. I say malaria ya kichwa. So persistent socioeconomic pressures. Socially, maybe you are the firstborn, maybe you are the only breadwinner, you have to provide. See, naleta pressure kwako, it gives you that again. And exposure to adverse events, especially in childhood, or on a large scale, like natural calamities such as floods. Children are young, when they are growing up, they are vulnerable to issues. Sometimes they undergo things and we think they have not undergone those things. The violences in the houses, they see them. The molestations that occur on children nowadays, children experience them. And maybe you hide them. Maybe the mother feels nikisema itafuzwa kwa hivyo. We have had such. So she hides it. And the child looks and smiles like it is okay. But it is not okay. Those are traumatizing experiences. They will come back to bite society. Not you as a person, but society. Can you imagine that at the age of 4 years, as a young boy, you are sodomized? Will you forgive society unless you undergo counseling? You always look at people and think, sasa ananiambia nini, anasema yenye nimepitia. So you have had such comments. Anajua kule nimetoka. Wewe ndio unajua kule umetoka. Unanielewa? And mtoto maybe was sodomized by a relative who was staying with them. And you say, in the room, your boys. Let the boys sleep there. So get to know your children and understand. Even the boy child is no longer safe. The boy child is no longer safe. The boy child is a problem. Tumetokea sana the girl child. The boy child has been left until now. The boy child is becoming naughty. Or which is the best word? Fit. Vulnerable. The boy child is becoming vulnerable. The boy child has been neglected. So let us protect our children. When we talk of molestations, we always think of the culture. Nafikiria tu ni mtoto msichana anaweza fanyiwa hivi. Kumbe the boy child when umewacha na ndugu yako kwa ile room is also undergoing something and he has been made not to say. And because you are also not there, unatoka asubuhi unarudi jioni na unamuona and you are still. So let us agree that even the boy child is vulnerable and the boy child needs protection, just like any other child. Stressful work conditions, factors that can interfere with the mental health. We spend a lot of time in our workplace, especially us in Generation X. We used to leave in the morning and go back home in the evening. At least meaning unafanya kazi labda nyumbani from home and what have you. So when you come to workplace in the morning and leave in the evening, it means you're going to spend almost 8 hours there. A day has 12 hours. So imagine where you spend your 8 hours. It has to be friendly. If it is not friendly, what happens? Hata ukifikiria kwenda kazini unachoka. Na ukiingia huko, now you want to change. You are smiling, but as you enter, you are not smiling. So a work environment that because you are going to spend a lot of time there, 8 hours, and you are going to interact with these people, you are going to socialize with these people. Stigma and discrimination, e.g. gender discrimination, social exclusion. Stigma and discrimination. Wakati tunakuwa na politics, now you identify each other with their tribes, you start discriminating. And yet this is the person who was giving you salt to the other day. Ama sio yeye. Mama Njeri mwenye ulikuwa na wacha mtoto kwake. Ama ulikuwa na wacha ndio uende kazini. When your house help ameenda, si unawachia Mama Njeri. You trusted Mama Njeri at that time. What happens during politics? She stops being Mama Njeri. She used to give you salt. She used to cook. Hata anashare chakula na mtu wako. You are someone that you love the most. Tulikuwa na mwacha huko. Ama tuwachani huko. Suddenly, why has she become? Why are you isolating her? Why are you socially excluding her? When you're whispering, you whisper, you don't whisper to her. Huh? Na yeye anachunga ule son wako ule. That precious son of yours. Tunaelewana? So let us learn to not cause mental health illnesses or mental health challenges. Because she will wonder, kasi huyu, si mimi nimekuanga nikichunga huyo utii wake. Sasa imekuwaje? Hata utii akikuku, si mimi nimekuwa nikipaguza ama sio, si mimi mikono. Sasa nimefanyia yeye nini? Na umemfungia. Sasa Mora utaki Mora atoke. Upendi Mora. Kwa nini upendi Mora? Amekufanyia nini? You as a person. Amekukosea. Na saa zile una hapa kupeleka mtu. Si tunapeleka huko ama? Or how do we live with our neighbors? So we take our children to our neighbors. But now, suddenly, something has come up. And then Mama of this, when they did not even used to give you salt, now becomes the most important person in your life. Na siku ile ulituma mtoto usiku ati mtoto aende aombe Mama of this chumvi, akakataa kukupatia, akikwambia kimila chumvi atupeanaje usiku. Na ukaenda ukatuma mtoto, akaenda kwa Mama Njeri, na Mama Njeri akakupatia salt na ukajisort, si ndio? But now suddenly something has happened and now you feel you want to align yourself to Mama Odis because you speak the same language and want to socially exclude Mama Njeri who has been giving you salt. Is that okay? Isn't she wondering yawa? Kama ni kweli kuleta tabu, si ningeleta hata kitambo. Wakati nilikuwa nachunga mtoto. Si nimechunga huyu mtoto yake hata akiwa mgonjwa na niwachia hata dawa nimpatie. Na mtoto ni mgonjwa. Mtoto mgonjwa hata akienda kukufa, si alikuwa mgonjwa. Amempatia dawa. Amempatia Panadol. Akakupigia simu na pesa yake. So let us learn to stop stigma and discrimination. Sawa sawa. You are causing trauma. Sawa sawa. At individual level, I'm not talking about group. I know when there is mass, people change. Hata mwenye alikuwa mpole sasa alikuwa mkali. So I'm saying at an individual level, talk to you, talk to me. Have a conversation with yourself. Why am I doing this? Do I need to do this? Have your personal conversation. Are we together?
Yes.
That we talk to us. Don't wait for the group to tell you. Unhealthy lifestyle. What are unhealthy lifestyles? Can somebody identify some unhealthy lifestyles that we do? Sedentary lifestyle. You're not productive. Hata uamke asubuhi uende mahali. Umekaa tu mchana tu unabadilisha. Asubuhi mpaka jioni. Asubuhi mpaka jioni. Hizi ni simu. Things have come mpaka AI. You are not socializing with anybody. Umejifungia kwa nyumba, utoki kwa nyumba, ni simu. Bora data iko. This slogan inatumia. Bora uko na simu, imejaa na iko na data. Iko na internet. Allergy forming allergy for society. Hata utaki kutoka nje, usalimi Johnny mumeamka, hata sisi tumeamka bwana. Na ilikuwaje nisikie kelele mtaani, kulikuwaje? Wewe bora uko na simu. Hata nini kwa bedroom? An introvert. Is that an introvert?
No.
Or a lifestyle?
It's a lifestyle.
Umejifungia bedroom. Utaki kujua hata ukisikia nduru kwa jirani. Unhealthy lifestyle. See, we talked about socialization. Hata ploti na ukua yawa. Si utoke nje uulize na hiyo mondo. Those are some of the unhealthy lifestyles. Another unhealthy lifestyle. Poor eating habits. Sio? Poor eating habits. Atipatia mtoto nduma na magunia ende nao shida. I see my granddaughter telling me, shoo kweli. I ask, but hii nduma, unajua klasi ya nduma kweli? Shoo. Unaingia nyumbani. Is that true? Is that true? No. Mtoto aende na juice, sijui na pizza, na biscuits.
Ringo.
Those are very when we talk about mental health, we also talk about nutrition. The things we eat, there will be retardation in your growth. That's our total food. So let us open up our minds and encourage foods that are worth eating. It starts with me and you. So I say, when I love this kid, and I remember since then I prepare with it, so she goes with it, mwanzo anapea wengine, but with time she learned that she can also consume. So we debate. But the mother feels, oh, biscuit ndio kusema. I said, no, hata githeri sio kitu mbaya. It's not bad, but it starts with me and you. If you start githeri, you start githeri. Oh, so hata nani alikuja nayo? So hata nani, sio? These are good natural foods, sio? Ma ukitaka wa mabuoni iko vibaya kweli. Haiko vibaya. Sio? Unhealthy lifestyle, other unhealthy lifestyles, we talked of the social, we talked of the eating habits, another unhealthy lifestyle. Pardon?
Like in a scenario, we are in a school, like in a community. Now, let me talk about school, a primary school, a BCD school. And then mzazi anakuja, we are in a meeting, and then kids are sitting together. Because most of the times, we parents don't spend time with our kids, but we don't spend time. So unapata there's a meal every day, like Monday, they eat rice, Tuesday, they eat chapati, Wednesday, they eat rice. So unapata once in a time, when we have a meeting, mzazi wakiuliza mtu ako na shida, mzazi anatuba mkono. Mzazi anasema, inafaa msend a habit of this day. Like, let me give you an example of where my daughter is learning. They eat rice on Monday, Tuesday they eat chapati. Wednesday they eat mboga. They used to eat omena. There's a parent who complained that omena is there. So unapata na point mzazi anasoma anasema, you should change this diet. Or you put a special diet on some kids because they don't allow food to school. So wanasema kama watoto wanakulanga kwaona kwa wanaweza. So mzazi mmoja alisimama akasema mtoto wangu hawezi kula kwaona kwa siku ya one pot yeye anakula tu ugali bure na maji. So it's kind of an unhealthy lifestyle. Nataka mtoto akule cabbage kama sukuma. And yet the school can't hawezi fanya hivyo. Wanataka kids to be united together. Nataka wazoee ile moja. Sijui vile inaitwa, mnaweza nisaidia.
Hiyo kutafauti kuweka mtoto separate sasa. Yeah, kule separate. Special. Is that okay?
No.
If you have children, is it important that akue special?
No. Unless they are having a medical condition.
Yes, unless they have a medical condition. Kama ni mrere, si teremke tu. Wacha explore. Mtoto explore in preparation for tomorrow, because you never know about tomorrow.
Yes.
Wacha teremke na mrere. So that when this is what is available, when shock comes to push in life, people always turn back to their primary socialization. Like sasa sahi chumvi ni ngumu. Sahi si watu wanakula mrere. They ina grow too wide and we appreciate serious. So let us bring up our children to let them learn that anything goes. Kama ni kumbe iko makosa gani kula? Yes. And if you have an attitude about it, don't bring the attitude to the child. Leave the child free. I explore. That is why they are children. Mtoto hawezi kula omena. Na mtoto hajakataa. Sasa akienda kwa jirani anakula omena. Kubali. Sasa kuna mtu achakula. Kama anataka kwenda na omena, siende na omena. Si ati kama inamletea medical condition sawa. But kama ileti, let them eat. Because as we grew up in the generation where we used to eat in the neighbors, whatever they are eating, mnakula tu. Mnakula tu, hata ujui ulikula nini. Sijui inaitwa nini, au kuli na unakula, si ndio? Bora umeshindwa. So you give a child to become a child, to explore. It is their time to explore. Sawa sawa. Yes.
Poor sanitation and hygiene, can you say it is a healthy lifestyle?
Yes, yes. It is a. Can you imagine you want to go to the washroom? Now imagine if the washroom in a car. What happens now? So unakuwa stressed.
Yeah.
And then what happens? Unashagundua kwa kina Joni inakuwa poa. So una time, na mama Joni pia hataki. You now start playing hide and seek. You want to go to the washroom, lakini yeye si poa, lakini kwa kina Joni ni poa. So unangoja jioni, alafu unajitisha hivi kando ya ukuta, ni kama unapita. And you're just going to the washroom, aren't you stressed out? And yet those are things you should do naturally. I una slide unaingia ndani ya karaka. Day 1, day 2, day 3, day 4. Mama Joni amekupata. Na mama Joni ni yule mama Joni. Anakugombeza, anakufuza, alafu unaangalia unashindwa sasa next niende wapi. To the extent even to another plot. Why are you going through this plot? Because the environment is not good enough.
We have one here. What of poor social and communication?
Yes. Mental state. Poor social and communication can it affect? When somebody tells you this and means this, or when you want to get communication is important. We want information. When somebody denies you information, how do you feel? Tuambiwe. Tunataka kujua. See, always when we are making demands, we always want to know. And when we know, we don't have. I'll get out of it. And there's nothing much that was done. You are only informed of what is going on. Like if you are not informed that I'm coming here today, and suddenly you find me here with a few people. Na wanatumia kriteria gani? Ni nani walichagua? Kwa nini waliwachagua? Sasa hivi nimekuwa wengine wamekuwa mkampuni huko wanting to know. Alifika aje hapo na walichaguliwa aje? Na mbona mimi niliwachwa? Sikuambiwa, sikupewa opportunity. Na unajua mimi mental health hiyo ndio napenda. Wanajua kweli. Now there will be another so it is important to communicate. Communication iwe kwa nyumba, iwe na watoto, iwe kazini, iwe barabarani, even the words we use. Mtu akipiki amekubeba, unaelewana vipi kabla mwanzo safari. Niko na ida, niko na ida. By the time you reach your destination, hata ukipatia 1,000 na mlielewana 50, si atachukua 250. Na sasa ukipatia 1,000 na mlicommunicate na amechukua 100. Now what begins? The war begins. Serious. But if you didn't communicate, and maybe yeah, I know you. Ukifika hapa, sasa vita inaanza hapo. So the most important thing, inawezekana. Sasa kuambia, sasa hivi inawezekana. Sawa, friends. Mnaanza safari mnaenda. Peaceful. Mkifika destination, si mnaachana tunasema ubarikiwe sana, si ndio? Lakini hii mnaachana siku nyingine nitakupata. Nitapata wapi? Na huko nikatameka. But let me warn you, nitakupata. Because there was a communication challenge. So communication is important. Even in the house. Mimi mshahara napata shilingi kiasi fulani, si ndio? So let us budget within our scope. But ukinyamaza, si unajua na assume unapata 100,000. Na kumbe it is way. You have not communicated. So yeye kwa assumption and assume, sasa tuishi nyumba ya hii tufanye hii. Tumeelewana? So let us communicate. Communication is a topic on its own, very massive.
Could financial indiscipline also be an unhealthy lifestyle?
Yes, financial indiscipline. Kwanza hiyo ndio shida kubwa. And I don't want to mention the gender. We have financial discipline. How do we discipline ourselves? That is in a topic on its own. Because most of our wars come from finance. Tulikaa chini tunasema sisi kama nyumba ya mnyango. Pesa hii income yetu ni kiasi fulani. Maybe total income 20,000. So 20 tutafanya hivi, tutafanya hivi, tutafanya hivi, tutafanya hivi. Sio? 20 kaingia. 20 kuingia, what happens? Sasa discipline inakuja finance. What happens when 20 imeingia? Pesa imeingia. Ya mzee imeingia, ya mama imeingia. Umeweka kwa report. Ama zimekosa kuingia. Alikuwa anaenda kutenda yake bana, akakutana na best friend wake, akaipa shida zake, hawamenda jela. Na nini hapa na shida, akachuna ndio akampatia. Already you have started feeling this. Because the agreement was bring this amount, serious. So already the dispute has begun. So when you come to the house, what happens? And I know the ladies. Ukisema ni 20, 320. Ukianza kumwambia nilikutana na fulani na shida zake niliona ni mingi mpaka nikachuna 5 nikampatia ile resort. Will there be understanding there? Stressful issues happen. Sasa mnaanza kuzozana, si ndio? So financial discipline is also part of things that cause mental health issues. Financial discipline. So let us learn to be financially disciplined. Sawa. Yes. Financially disciplined. Yeah? Physical illnesses and some infections, e.g. chronic ailments. Mental health issues, physical ailment. If you have been sick for long, you have a long-standing chronic illness. It brings a toll on your mental state. Go to the hospital, a diagnosis is made. Maybe CA, cancer of the colon, cancer of the cervix, cancer of the prostate. It changes you. Even when you live there, ya kwanza hata bado uamini. Maybe you are physically healthy, but somebody has put a big diagnosis. You undergo investigation, the diagnosis is persistent. It affects your mental state. And then now, it also affects your lifestyle. Overall, turn around in the house. You go to the hospital, you're told you have diabetes. These are diseases that are chronic and they might be there for a long time. So what does that mean? Lifestyle change. Psychologically it affects you because it is you. Unaambiwa sasa hautakula hii, hautakula hii, utakula hii, hautakaa njaa for long, you have to change your meals. So the whole family has to change. If you have somebody with diabetes and you want to support them, do you remain eating your chips and white ugali and what have you? You will try to cross over to walk the journey with the person. Ukiambiwa mtu wako na hypertension and you stay with the person, so uta minimize stress ama utaendelea kustress. So we have to change our lifestyle. Pesa yake itakuwa inaenda kwa dawa. So akachukua maybe a bulk of the money inanunua dawa. Sasa unashindwa ni dawa tutanunua ni chakula tutanunua. Sivyo? So you have to accept and come to terms and bring a balance in your mental state. Sawa. Some of the things that cause mental health issues. Human rights violation. When you feel you don't get justice, do you feel satisfied? You feel something has been left amiss. Like the man whose son died, I usually don't like watching it. It hurts me. I feel so bad for him. When he does not get justice, mentally he will always be disturbed. Where did I go wrong? Because when the law enforcers come to your home and you're told 1, 2, 3, 4, so you obey the constitution and you obey the law. Senior. So you release your son in good faith. December, I know we have a constitution and we have a law and we have a government that has it. So you release the wako. Enda usikie wanasema nini. Maybe pesa yangu kidogo utakufuata baadaye. Sikuwa tunasema hivi. Enda tu suddenly you do not have your child, it's not a good feeling. And if it doesn't get justice, then mentally you will not be okay. You will always feel, I should not have let that child go. Maybe I should have even gone instead. Maybe I should have hidden him. Maybe I should have, maybe, if only still. So he be tortured. And sometimes even when you get justice, you still feel it is not worth. It's not, it does not, it, yeah, it doesn't support what happened. The loss is too much. The loss is too much. Taking care of a child up to that level, mtoto amekuwa mtu mkubwa, and also mtoto mwenye you have struggled. Bringing up a child is not easy. It is a journey. It is a process. Mpaka ni mtoto mnaweza ongea mkaelewana, mkashare ideas, ukamtuma, ukamwambia kitu, and then suddenly he's not there and he's the tomorrow. See, our children are the tomorrow. So now you are seeing like a bleak future. Your tomorrow has been interfered with. So human rights violations, when you interfere, when you are enjoying your rights, it does not mean you interfere with my rights. When you are shouting for your rights, according to the Constitution, do not infringe on my rights. Kibanda ya mama mboga, mbona unatumia chombo barabara? And that is where she gets her source of income. But when you are irritated and agitating for your rights, you have to really burn down that kibanda for her. Because that is how it is. That is how they are true. So when you are fighting for when you are agitating for what is rightfully yours, you do not have to infringe on somebody else. Because this mama asks herself, kibanda ilifanya nini? Kibanda ilikosea nani? Unaelewa? So as much as we are suffering mentally, don't inflict mental health issues on somebody else. Am I speaking English? Yes. So can you leave kibanda ya mama mboga alone? Yes. Because she will come tomorrow. And this is the place that pays school fees for her children. Yes. Specific psychological and personality factors that make people vulnerable to mental health problems. We have individuals with different personalities, and our personalities sometimes dispose us to mental health problems. We have aggressive personalities, people who are by nature they are aggressive. Now we have dominant personalities, attack maneno, na ni personality yake sio. But in life you don't learn to balance. Sasa zingine taka maneno, you have to know how to use what when. So if your personality, your dependence, that is when, for example, the sister is married to an aggressive personality. When you go there, what do you do? Mimi ningekuwa nishatoka kitambo. Anafanya nini hapo? But she has this personality that is dependent. Anasema labda atabadilika siku moja. 5 years down the road atabadilika. Sasa wewe mwisho unasema nini? Umetoka na yeye sasa. That is her personality. It makes us, she knows the problems. Believe me, she knows. And she's even tortured by these issues. But she's this personality, always dependent. What at the end of the day? Love that about you. Love that about you. But you are the one who says, so personalities is sawa. So let us not judge people and their personalities. If she's that kind of personality, walk the journey with her within personality. Because it's personality, we need behavior change therapy. We don't need to shout at them. Atoki, you need to talk to her now. Talk to her, explain to her, let her see the consequences. Pole sivyo. Lakini ukienda na personality yako ya aggressive, bado unafanya nini kwa hii boma? Si nilikwambia hapa hivi hakuna chako. Twende hata ukute na gari. And she tells you, labda atabadilika. Tupatie time. That is her. She knows she's not on the right track. She understands, but she's going slowly. Sawa sawa. So explain to her pole pole, wacha aelewe that it is not okay to be like that. Sawa sawa. But don't go there with your personality that kama ni mimi. Hey, hii goma imekuwa inawaka moto. That is you. Please. And that is her. Sawa sawa. So you are causing her a lot of stress because she has a different way of sorting out her issues. Sawa sawa. But you stand with her. Always be there for her. Umeelewana? Sawa sawa. Genetic factors run in the families. We said biological factors are some of the factors that mental health issues are based on. We have hormones within our bodies. They are called neurotransmitters. Ndio unakuta mtu anaamka asubuhi anasema, niliamka kama niko off mood, lakini sasa hivi naona nachangamka. Our body generates neurotransmitters. Sometimes they can be high, sometimes they can be low. Sometimes nani anakuwa na mood. Siku nyingine unakuta amefurahi, siku nyingine amehuzunika. These neurotransmitters are genetic, some of them. Sawa sawa. Ndio unasikia hiyo familia watu ni leo. Watu ni leo. Na kweli mwingine kama mwingine, sio? There are people with maybe the neurotransmitters inatoka nje. Inarejeletiwa nje. Sawa sawa. So they are hyper. Hao wako tu sawa. It's a family where issue tu ikitokea kila mtu ashakuta kibovu, kila mtu na kuna familia nyingine when an issue comes everybody is like that. So families differ because of the neurotransmitters. Sasa the dopamines, the serotonins, the GABA. So we say genetic factors run in the family. You find like depression and suicide run in the family. Unakuta babu yake, mama yake, babu yake, mama yake, kuna mama, hata ndugu ya mama, sio? Some of these suicidal ideations run in the family. Sawa sawa. They are susceptible to certain mental illnesses. So let us not die. Remember illness, after that. We have a few common mental health disorders. Have we heard about them? Depression, anxiety, post-traumatic stress disorder, schizophrenia and psychosis, alcohol and drug use. Depression. What do you hear about depression? Has somebody heard about species and before being species? Nasikia people are being diagnosed with depression, even though they should not be. We have got a depression. What is depression? Somebody who heard about depression, under what context do you hear about depression? Somebody has heard about depression. It's one of the living. It's there. We have said it, we have used it. Now here we have got a depression. What made you think after depression? What did you see? Can somebody help us out? What did they see? But I'm not saying we go and diagnose people. In fact, the mistake people make in mental health is that ukishasoma hivi issues mental health, unatembea kwa barabara ukitafuta watu don't diagnose people. Sawa sawa, tunaelewana? Usiangalie huyu ni depression. Huyu ni anxiety. Huyu leave it to the specialist. Sawa sawa. Utapeleka kotini. Forensic, utapeleka kotini. But we are saying learn and get to know them so that you can assist them. After the diagnosis has been made by the specialist, we will walk the journey with them. But know the symptoms that they will elicit. So that by knowing the symptoms, you can know where to direct them. But don't diagnose them. Usiseme wewe nimekuangalia vizuri na hii masomo yangu, wewe ndio depression. Usimwambie, sawa sawa? Are we together?
Yes.
Let us not diagnose people. Tunaelewana? If you feel they have a need or they have some gaps, send them to the specialist. Tunaelewana? This is the era we are given in class. Kweli na nini hivi na hivi. So we should not make this diagnosis. Sawa sawa? Depression, how do they present? What did you see?
Isolation and
Isolation. That is. Stigmatization. Overreaction. Depression. Overfeel. Overthink. Agitation. Withdrawal. Depression. Okay. Anxiety. Anxiety. How do you feel? Somebody with anxiety disorder. Rebecca depression there's a friend or a colleague or a relative with anxiety behavior. We live in the community. Serious. Do we have friends and relatives? Or we don't relate to them? We relate serious. So how does a friend or a relative with anxiety behave? Constant fear, overthinking. You're always anxious, anticipating something will happen, and maybe something that has not happened, or thinking something is going to happen. Every time, anxiety, yes. Undecisive, anxiety, post-traumatic stress disorder, common mental disorders. Have you come into contact with people with post-traumatic stress disorder? You come in contact. What did you see? Or how are they behaving? Post-traumatic stress.
when they experience the triggers, they fear and they're just scared.
Post-traumatic stress disorder.
This is a person ukipita karibu na yeye, pia naona tu anashtuka. Hata ukimuuliza kitu, atakuwa anashtuka. And that's why
They're always on their alert, like they're waiting for something.
And they are always suspicious.
Always suspicious.
They look all around them. You cannot come close to them. Don't. Hawezi kaa karibu na yeye bila ama hawezi fanyia hivi ama kumwongelesha.
Some are restless. They isolate themselves. Schizophrenia. I put schizophrenia because you wanted psychosis. And psychosis works along mostly with schizophrenia. So schizophrenia and psychosis, how do people behave? Schizophrenia is a group of mental disorders. There are so many. It's not like one diagnosis. There are a group of a class of mental illness called schizophrenia. So you can get paranoid schizophrenia, catatonic schizophrenia. Outrage. Aggressive, physically aggressive schizophrenia. Somebody else schizophrenia, psychosis. They tend to overreact. Psychosis.
Schizophrenia, they tend to hallucinate and think that they're someone they are not.
Hallucination. Perceptions. Yeah, perceptions. Yet atakwambia yeye ni president. And don't waste your energy telling him he's not. Why are you wasting your energy? Si wewe unajua huyu si president. Na yeye anajua ni president. Mbona unajisumbua kumwambia huyu si president? Now you start being aggressive. Akiingia hapo akwambia, habari zenu, how are you my people? Sema we are fine. What does it cost you? Nothing. Yes, these are my subjects. Kwanza huyu, sasa hiyo ni ndugu yake mwenye amemleta. Kwanza huyu ndio bodyguard ya nyuma, huyu ni wame. Because if you're trying to identify your client for how what is you, utatulia tu kwa kiti na unamweleza. Na anakwambia mimi ndio president. Sijui tumepiga kura. Kama ndio tumepiga kura. Mtawe ni president ya nchi gani? Anakwambia ndio Uganda. So you don't become violent with them also. Una insist wewe si president, wewe si Museveni. Sio unajua bora unamwambia. Tutajua hiyo pole pole, sio? Wacha tuone, tuongee. But don't affirm his lie. Usiconfirm at yeye ni president. No. Don't tell him you're Museveni, but tell him na kukaribisha kwa kiti. Mimi wanapenda kukaribisha wageni mheshimiwa. Ndio. Hujakaribisha Museveni. Because if you affirm, he will hold you to account. Kila siku atasema si hata wewe ulisema. Hata daktari akubali mimi ni president. Alafu mimi ni kina nani hapa? Who are you talking? Unanielewa? So don't affirm those beliefs, but handle them within the scope of that belief. Karibu kiti mheshimiwa. Is it bad to call anybody mheshimiwa? Is it bad to welcome them to your chair? Is it bad to acknowledge their presence? So can we acknowledge them? Can we give them a chair? Can we attend to them? But at the back of your mind, Museveni hajafika Kenya. Unaweza kulingana. Yes. So that you create a good rapport. Otherwise ukianza kubishana, mtabishana until the sun goes down. Alafu sasa hiyo rapport, you will not succeed. Hata kama ni dawa nataka kumpea, unanipea namna gani na mimi ni president? Na ulisema mimi sio, wacha.
I have a question on that.
Yes.
There are these people who tend like impersonating so much. Like after a shift work and the local police station, maybe impersonates being a policeman. Na pia handle watu mpaka unakuta watu wampe pesa achukue hongo. This person is just ameamua tu yeye anataka kupeleka kwa watu wanajua because maybe one day someone will tell her, unataka polisi. Sasa yeye kama yeye ni polisi. Na yeye everywhere he goes or she goes, she's a policewoman, yeye ni policeman, na pia kuna watu wanabelieve yeye ni policewoman, mpaka hata anachukua pesa kwa watu. That person will be having the same problem.
That person most probably. And psychopaths are very smart. Psychopaths' personality. They are very smart, they are very bright, and happy my environment. They are the ones who will call you when you are not. In fact, have you ever seen you following a person? Yes. So most psychopathic personality, they're usually very bright, but they have antisocial behavior. So they can take advantage of any environment. If the police environment suits you, and with the smartness, they are the police. Kama inamfaa, atakukoroga kichwa, and you accept the police. And he behaves in society also with them. Actually, anavaa ananywa police. And then there are ways of identifying who are police. You can know a true police if you are really interested in it. But this is just like a shortcut. So akikuja asema yeye police wewe unasema yeye. Alafu akisema yeye unasema yeye. So ashakustadi akajua hapo.
But there's a status where this person has decided to even become a friend of all the policemen everywhere. So if he tells you, she tells you the policewoman, atakupeleka kwa vyenu. Ukienda kwenye utapata tu kwenye polisi wote wanajua. Na yeye ni polisi. Ukienda Central amejulikana. Na polisi wote kwa barabara au wa traffic anawajua mpaka na mjini.
Psychopathic personality have short-term lived friendship for their own gains. He's gaining by being a policeman. So what is wrong with being their friends? But ukimuuliza in details, asimame na wewe as a friend. You've never seen that. But if it suits me, to get to know those, very funny, and most people, akona kizungu zake, akona dressing code mzuri. Yes. Maybe alipitia hiyo kozi ya polisi kidogo. Maybe hata alikimbia Kigali for 1 month. Wakamwambia wewe baby rudi nyumbani. But he has an idea of what happens. So maybe the few people who are in that police station, they were together in Uganda. Wewe mwenye ulikuwa naye kule jana kama ni drop out, utasema unjui. Si tuko na yeye. Aki timu tu. But at some point, he has an idea what happens there. So when he comes with that confidence, but then Johnny, Mo, sema habari ya masiku, kumbuka kiganjo, wewe umeshasikia kumbuka kiganjo. Wewe ndio unaruhusu. Wewe ndio ndio. And nobody asks, what could you need? Nimaliza. Sasa kiganjo. Alafu wewe ulikuwa unasumbua, hata ujinga tu. Now you are confirming he was there. But he never qualified to be there. So he's just taking advantage. And most people gains for his personal gains. And those friendships are not deep friendships.
And now that you say it could be somebody who maybe went through the process to have cancer. Can we turn it like maybe he has a mental issue that has not allowed him to accept that he did not qualify? He still thinks there's a mental issue that is telling him, I still belong here, as much as I was sent away.
Personality disorder. It is not a mental illness. Most personality disorders live in society, comfortable in society. The ones who seek treatment are the ones being frustrated. But yeye hajakosea mtu. Kujua maaskari kwenye ni makosa. Kujua askari wote wa Central Police ni makosa. Hajakosea mtu. So personality disorders will not really chokoza mtu directly. Yenye umshike naye useme ulikuwa unasalimia maaskari wote kama unavyojua. But they're smart. So they will have acts that mwenye anamjua anamtrack can say huyu mtu is a problem. Not everybody who comes with a mental health clinic has a problem. In fact, wao wamewacha problem nyumbani. Mwenye anakuja for treatment amewacha the real problem nyumbani. Like you find you are a couple, you are staying together. You decide to put a tracker kwa simu ya partner yako bila kumwambia. Is that normal? Gari amekununulia. He has bought you a very good gift and he has put a tracker on it. You become that way. Now who is it? Yeah, I'm aware. But we people know. When we come to the house, we say, napenda namtunza vizuri, hata mnunulia gari, hata kuna simu ya maana. But his simu, he's in South Africa. I had such a client. She used to come and be admitted in Africa. Na analala tu because she's stressed out. Bwana amemnunulia simu ya maana. Akiongea na wazazi nasema sijui baba nani anafanya hivi sijui atiwacha turudi umlete nyumbani tuongee na yeye, si ndio? Amesikia amesikia. Akirudi akitoka South Africa kaja gari shopping naingia sofa chukua vitu nachukua sina chukua vile napenda naenda nyumbani nafika kweli akishafika shopping mama alikuwa si unajua sisi wa mama ukishaletewa kwa usiku vitu unaiweka chini ya kitanda you will come to sort it later alafu akikuchikia kusahau kuchikia kuna haraka kidogo. You see he's manipulating now the situation. He already knows he wanted to take people to go and find a place kidogo na wazazi, but he's manipulating the situation like see. Sasa kufika huko hiyo shopping mama bado anang'ang'ana kufunga box kuingiza baby box atawachani sisi ndiye kana anaweza kuja apate hiyo toast hapo. So like hizo then baba anaambiwa hii shikilie nayo amewatiwa 20,000. Mama amepewa 10. Mama amekuwa na Muganda ya 5,000 imemsumbua, atasikia mambo yako kweli. So who is in control now? He has brought you and then wacha tukimbize kuku, msikimbize kuku, kile tutapanga. And then he puts you in the table, brings you back at the money, and then unaingia huko kwa nyumba na story imeisha. Was your problem solved? So who goes to the mental institution? The woman who has something to say, but she has no opportunity to say because the guy is smart enough to outsmart her. Now, really, we have it on a track. So, psychopaths will manipulate the environment to suit them. And their friendships never last. And they always feel society owes them. Society will kosea mahali. These are the people to be kosea when they were growing up with their family. This is the one that you used to sodomize when he was young. Now he has grown up. He has come back to society to revenge. But now you will not know he's busy revenging. This is the child you gave back to and threw in the toilet. And he has grown up and he was told, I don't know what you are sure. I don't know what you are sure. So nobody wanted him. Who that time was he was his mom? I was not even adopted in the right way. Adoption is not bad, but it is done in a right way. But now you are just picked up. The way a stray dog is picked up. This is one person who is going to grow up very bitter. So he's coming back. So he has come back very nicely, in good clothes, very decently dressed. Now, how do you are dealing with a personality disorders? And personality disorders are rarely admitted because our behavior is judged by society. Na society imesema ni vibaya kufanyia shopping mpaka hiyo. Society imesema ni vibaya kununulia vitu gani. Society is comfortable with that. Society imesema ukiweka picha reshi na reshi ukijaza fridge na chakula sana yako vizuri. When you want to know if the wife is at home, you know how it goes. Because the watchman activates, na watchman anapeleka simu. Can society judge me that? Atinapigia watchman yapelekee vitu simu kwa nyumba. Anasema, oh, nimepiga simu yako wewe mteja. So I decided to call security guy akuletee simu. Kuna makosa hapa? Is there a mistake? Where is the mistake? Nitakeni nyumbani ya kiti yako. Amekuletea simu. Oh, baba nani amepiga? Baba Ipina amepiga. Ndio amesema hajakupata kwa simu. Ulikuwa mteja. Is it bad for your husband to be concerned? He wants to talk to you at that point in time, and you are mteja. He will not access you on your phone, and he has looked for an alternative phone, and he has called you, and you have been brought the phone, and he's talking to you. Makosa yake. Are you getting it? Yes. He's tracking you. But he's tracking you so smartly that the law cannot catch him tracking you. Yeah. He's tracking you so smartly that your parents cannot stand with you. Unasema usifanyie nini wacha kuje. Ulete nyumbani fanye kesi. Amekuja baba amepewa 20. Na yeye anunuliaje watu kwa kituo huko? Yeye ananunuliwa kila siku. Sasa leo sana ndio akuja na mimi ndio niende ninunulie watu. Iko makosa gani? Is it bad? No. So psychopath personality disorders are the ones who cause problems, but they are hiding. They are so smart that kumpata is not easy, and to handle them is behavior change. Medication does not change their behavior because hili personality alizaliwa nayo ama alipata kwa environment as he was growing up. When he realized the environment is hostile to him, he decided he wants to revenge the environment. So he's doing it in steps. You're not the only one. Maybe he's doing it to another person. Maybe he's in a relationship doing it to another. Maybe he's doing it to another brother. But he na kweli hapa, lakini si mbaya. Sometimes we see people's problems and then we say, lakini ukilinganisha hii na hii, si mbaya. Amekupiga mpaka anamtaka hivi, anakupiga hapana, ananunua chakula, analipa nyumba, analipa watoto shule, bado anaendelea na shida. And then mothers in laws kama nimesema, they tend to say, unajua mimi wakati yangu alikuwa ananipiga hata nini chakula, sasa ameanza kukompea, si ndio? And then you are made to look like you are the problem, si ndio? So you grow back, and as you grow, your mental health status is affected. So you are the one who will end up at your yourself. But personality disorder, catching a personality disorder is not easy. Maybe it takes a specialist to catch your personality disorder. They are very good. They are very good. Yes. Personality, the other person. So the victim should also be assisted to understand what is rightfully hers and what should happen to her and what should not happen to her. I don't know some of you, if you are there living on Yanchi, there was a guy called Yanchi who used to murder young children. Na si alikuwa anaitwa ya watu. Na tena ni watu na mwalimu. What happened? How do you trust somebody who keeps murdering children? And he's still there, very smart. Hata alifanya form 4, akapata B class, nini, akikuwa kwa jela. But then alisema accepted alikosea. So personality disorder, the message I'm trying to pass is that personality disorder is a challenge. And personality disorder, huwezi kumpatia. Unlike the one who said is a president, that is psychosis. Huyo utampatia dawa kesho atashangaa. Huyo mwingine pia anasema sijui ni nani, wacha tu atampea dawa atakuwa kama the psychosis will come back to reality and face reality. But personality disorder is always calculating, always planning. I don't disongesha it go what will happen. And I calculate your distance. Na mbona disongesha? Could it be kuna kitu aliweka kwa hiyo? Kitu kidogo, a small act, lakini anaipigia hesabu kubwa. Unaelewa? Basi na huwezi mlaumu just by moving this last year and it becomes suspicious and it becomes in a suspicious way. Will you say alikosea kuniangalia in a suspicious way? Ama anakuja polepole anasoma, akiona umesongesha hii hapa, anaangalia alafu kitu inamwambia I'm not safe. Hata chukua hii chupa ya huyu, ajifanye amesahau anaikuja, believe me, the guy didn't forget. He was just suspicious of his body and decided he's not getting it. What happens? You take a body and they are taking us and now it's safe, serious. So hiyo ni personality. Na utapeleka mtu kwa mental health institution na alibadilisha chupa, akaichukua chupa yangu, hawezi, sivyo? So catching a personality disorder is a challenge. But a psychosis, tutamsaidia, tutapatia madawa, then ita balance, then utasita sasa. Alcohol and substance, you know it's similar. We live with it until we have perfected final drugs. Sometimes I went to a friend at school and they knew the drugs more than me. They designed a drug and I was like, you will be our so there are numbers, and there are some that come up that so far the books have not read, but that one is true. So depression, signs and symptoms of depression. When somebody is going through depression, these are some then you down. Feeling of low is certainly for opportunities. When you undergo a side effect, it should not go on so long. At some point, you go through what we call DAPTA. DAPTA is a process of healing. So in depression, the person is stuck maybe at the denial, maybe at the sad state. So you feel sad for opportunities. Things happen, but at some point you have to leave. Like the father of Albert, things are happening, but we expect it to be. Maybe his healing will take time because of the implications, because of the law and the forensic issues. But at some point, he will heal. He has to heal, whether he likes it or not, he has to heal. He will not heal fully, but hata kama anatembea na living, but he's healing. And then, tumalize signs and symptoms, and then we take a short break. Yeah. So another sign is loss of interest or pleasure. So you have things that you love to do, whatever it is that you love to do that gives you pleasure. When you're going into depression, you notice that your colleague or your friend or your relative or your child or your sister is now not losing interest. And it's where you listen to music. That's how that you music. So, feeling of hopelessness about the future, guilt, or low self-esteem. You feel there's no future. Sioni tumaini, sioni kupenya, hii tofauti kweli. Guilt or low self-worth. Loss of self-confidence. And the feeling is not just, you don't just verbalize it, you feel, you cannot. Hata ukweli kale, unaweza, jaribu. Mimi siwezi, unaweza, jitahidi. Unaweza toka kwa hii marriage na uendelee na maisha. Unaweza kweli, unaweza. And then as you are aggressive, tunakutoa physically, tunakuleta nyumbani. Alafu tunakuacha nyumbani, sasa kaa, sio? And you go back wherever you are busy. And then you keep telling yourself, naweza kweli. Unajibeba unarudi huko. Because your self-confidence hakuna. So when you are kubeba the aggressive sister of yours, yeah, you are those aggressive personality sisters. Ati, ala. Wow. Akakaribani kidogo. Sijui sababu mzee anacheza. Anacheza. Wewe uko Nairobi anacheza na yeye hapo. Yeye ndio hapo. But it is this loss of self-worth. She has no confidence. She believes she cannot survive without that partner. She cannot. Hata ukimwambia nimefungulia biashara, uza hii na hii. Kitu tu namwambia hawezi, hata uuze hii hawezi because of the stress. Depression. Suicidal thoughts or acts, fatigue, or loss of energy. They just have suicidal thoughts. Now, after that, you are survive. After all, let you go life. So, what is wrong with me then? But they made before we commit suicide, we find ourselves that is the accident. Up to there, any concern about science and symptoms of depression? Can we do a short video? We didn't do that class president how long but we can be self-disciplined enough to tell ourselves to end a child for this time and we do this time.
Sasa maliza. Hebu muulize kama maliza.
So I was So what we forgot to do when we started, get a timekeeper. Na mtu wa kutushinda kutupatia time. So I need those two people so that I need this monotony of thinking. You are young enough, eh? So as a timekeeper, nataka mtu wa kutupatia. Unajaliza every time we need it. Kufanya haraka tulichana. Yes, when you are timekeeper, then you really energizer. So timekeeper tunaelekea saa 8 is 10:40. So what time do we come out? That's for how long? 20 minutes. So 10:40 plus 20 minutes is 11 sharp. So 11 sharp we are here. So usigoje timekeeper aje kuannounce uko. Just be responsible and have it is very interesting, see? So we need the information. So let's have somebody give us a prayer. Good. Thank you.
As you are going for a short ride, pray that you will be with us, our team, as we take the rivers train, as we come to our second part of our session. It is Jesus' name we pray and believe.
Amen. So our tea is outside here on my right. Yeah. So now our bag, keep it shiny. If you don't feel comfortable sitting on the benches, you can come with your tea inside. So enjoy your tea. Oh, yeah, yes.
So finally, as we go out, if you have something to talk about,
And immediately you come from that tea, you make sure you have that attire on. There is a meaning with those standards.
Asante. Yes, tunaenda kuvaa hizo vitu. Tunavaa ile sasa na hiyo. Kuna hadi za blue. Shawali.
Ama
Acha.
Simon say hallelujah.
Hallelujah.
Simon say touch your head, touch your nose. If you touch your nose, it does. I'm saying you do what Simon has said. Simon say nod your head. Simon has said touch your toes, touch your knees. If you touch your knees, it
So we are all in. That is Sasa. I'm really glad here. Sarah, who is not here? So if your neighbor is not here, when they come, tell them they have letters down. Yeah? We need to be good time managers. You can imagine unafanyia mtu counseling, ama uko na mtu wa kumenta, ama kuna mtu uko na patient, and they wait for you. Is it right? So they need to find you. Yes. Ama mimi just do. They need to find you so that they feel comfortable. But if they wait for you, they can lose their patience. Sindio? Na waanze kuwa stressed. Sawa sawa? So wakikuja waambie they are letting us down. That is not a good quality. Otherwise, that was the tip. Tuko sawa? Ready for the second part? Yes. Karibu madam.
Asante.
And by then you look good.
How was your team? Was it what?
Yes.
I'm happy that you have the green color. Green metal. It's the color of metal. And I'm also happy that there is a talk about mental health behind. So it means when you walk in town and you turn around, somebody will recognize that someone is talking about mental health. As can I whisper something to you? When you put on this t-shirt, they will ask you about mental health. So pay attention so that they have something to say. When I put on my green t-shirt in town, now then I do for mental health. Oh, where for mental health? Nasema nilikuwa na shida lakini sasa sijui itakuwaje. And then I give them my phone number, utanitafuta. So even you when you put on, utakuwa unaita wateja sasa. Na ukiita wateja, have something for the wateja uliita. Sawa sawa. So let us pay more attention, let us be conversant, and let us not shy away from mental health. It's okay. Sawa sawa. It's okay to be not okay. Sawa sawa. Sasa tulikuwa tumetaja juu ya depression, the signs and symptoms of depression. So we are going to talk about help that can be provided. How do we get help for somebody with depression? Apply mental health first aid. I know we have not talked about mental health first aid, but we'll talk about it and then we'll apply mental health first aid to get help. Referral pathway, how do we refer? In our system, I'm giving the referral for our system because we live within our system. So in our system, the referral pathways is refer to the nearest health facility, dispensary, sub-county hospital of the county, whichever health facility is near you. Why am I not saying refer somewhere else? A lot of institutions have cropped up saying they're dealing with issues of mental health. There are a lot of ways people deal with mental health, and some are not appreciated. There are people who, if you have a mental health issue, you end up being taken maybe somewhere for prayers and you're tired and what have you. So I don't want to commit myself to private institutions. I don't know what happens there. I don't know how they are registered, but I will commit myself to my employer, my government. Yes. So when you have those challenges, please refer the mental health to the institution. or where you are sure there's a certified person working there. So. Anxiety. We talked of anxiety. We mentioned some of these signs and symptoms. Feeling nervous, restless, and tense. When you're anxious, you're always nervous, you're always tensed up. Hata mtu akikutaka tu kidogo, umeshtuka nini? Si ndio? Hata mtu and you're restless. You cannot sit in one place because your mind is occupied. You cannot focus on what you're doing at that point in time. Having a sense of impending danger, panic or helplessness. Sense of anxiety. Like there's something about to happen. You're not sure what it is, but you feel there's something. It gives, you even heartbeat in a panda when there's impending danger. Or when, have you ever walked in the street late hours and then unapitana na mtu and you have this feeling hapana, unasikia nywele zinasimama, sio? So you feel you are not okay. Or have you ever walked in an environment, even in a house, where people have been having an argument back and forth, and then you forget to use your sixth sense. So we have six senses. What is the sixth sense? You know the other senses. The sense of the perception, the anticipation perception, sense of touch, smell, taste, sight, hearing, but there's another sense that we develop in our life as we continue in the journey of life. The sixth sense, sense of environment. Unatembea alafu kitu inakuanzia hapana, sivyo? Watu wakipiga marisasi nasikia alafu bado unatembea. Si unajikuta tu umetambaa spidi, sivyo? Because you have this feeling the environment is not okay, sivyo? Even when you walk into your house, kitu tu inakwambia leo hii nyumba iko sawa. Or when you walk into people's houses, you go visiting a friend, but they've been having a very intensive argument in the house. Ukiingia, you feel the tension. The tension is palpable. Ama ufeel? You feel the tension. Watu walikuwa kugombana, hata mtu alikuwa karibu arushe skulu. Alafu wewe unaingia na unaona ni sawa. Hata mimi nilifika. Na unakaa chini and you even have the audacity to take a cup of tea. See, something will just change you. You just feel this environment is not okay. There is something wrong. Either you leave that house or you see if you can yourself. Unaweza muuliza Johnny, kwa nini? Depending on relationship yenu. Unaona kila mtu akisimama anaangalia bila anaangalia sio kawaida, not making eye contact, sawa. So we develop a sixth sense, sawa. When you're anxious, you have an increased heart rate, breathing rapidly, sweating and trembling. You are anxiety. You know, when you have to satisfy and examine. Is it satisfy or satisfy? And examine, is it? And then when you were young, I used to wonder what the policemen are doing with your heart. So we were told that, oh, you're I will not even feel. After we release that, they give you with a feeling of wasiwasi. Ukiona huyo polisi akitembea around, sasa ndio unaogopa hata zaidi. So it leaves you having an increased heart rate, breathing rapidly, sweating and trembling, feeling weak or tired. When you're anxious, you feel umechoka because your brain is overworked. You are anxious. You're always worried about something. You always think something bad is going to happen. Una panic, una wasiwasi. Hata mtu akikuuliza, you think umefika. It's just a feeling. It's a feeling. Trouble concentrating or thinking about anything other than the present world. Whatever it is you're worrying about, it's so full in your head that you have trouble thinking about any other thing. When you wake up in a kalam, you can repeat kalam with 3 times because the mind works like a computer. Sinasikia kitu and then unaweka kwa memory, alafu una analyze, alafu uta retrieve zaidi inatakikana. But now you are not retrieving kalam, because your head is full of whatever is making you anxious, whatever it is. So it is interfering with their thinking, interfering with their joy. Anxiety, help that can be provided. You apply mental health first aid. We talk about first aid. And then referral is the same referral pathways that we are using for other mental health disorders. The pathways, I stick to the pathways that are known to me. I don't feel comfortable saying you can venture into other private facilities because as mental health is coming up, there's a lot of advantage being taken. So you find people are addicted, they are changed, they are beaten. So I don't want to talk about pathways that I'm not sure. Post-traumatic stress disorder. Remember we defined it. Is a mental health condition that is triggered by a terrifying event, either experiencing it or witnessing it. It leaves you with trauma. Maybe you are not involved in an accident, but you saw an accident, and you saw limbs, in a duka, in a duka. Those, an experience I saw, I still see it sometimes once in a while. Somebody was knocked by a train, the head was cut off, and the head was still talking, despite being severed from the body. Because there was still blood supply. And it was still saying, I can really go for the yoga. So I still, so when I see a train is there, I'm making one as Mama Bani. Because it leaves you with a feeling that it's not okay. When sometimes you've gone through the experience yourself, or you have witnessed somebody going through the experience. You come up floods. Sometimes when floods occur, and you see somebody going, imagine how does it leave? It leaves you, when you see water, you remember. It leaves you with a bad feeling. So if you're not cancelled and walk that journey of cancelling, then it will traumatize you for a long time. You have a phobia of water. But life is all about water. Sasa utakataa kutembea ni gari ya moshi. Si lazima uende mahali. Lazima uende shuleni na hiyo ndio barabara ya kupitia ukienda shuleni. So you have to go through counseling and accept that things happen. It happened at that time and I have to continue going to school and crossing the radio. But sasa speed yenye napita nayo si ya kawaida. As we go a group of children, mimi niko na speed yangu nataka kusimama huko na speed haraka twende. But because of maybe what you experience. Even when you witness such things. What are some of the signs and symptoms? What are the things that when you see underwent a traumatizing experience and is not okay? Flashbacks. Do they get flash? Do you get? Can someone get flashbacks? Whatever happens here, you can repeat them. Nightmares. Usiku. Si wanaanza kulia. And then when we were young, when my brothers get nightmares, what did we used to do? My mom takes the Bible and is that a solution? Yes. Is that a solution? No. You encourage the person to talk about it. And when you're using spirituality, use it positively. Look for verses that encourages somebody in their journey of nightmares. Not the Bible. Now I know. By then I need to know. So look for verses that encourages somebody that inaambia mtu hapana, you witness this, but let us walk the journey of recovery. Sasa, severe anxiety, post-traumatic stress disorder leaves you with those feelings of anxiety. You're always anxious, you think it will happen again. You're not sure why it is not happening again. It happened once, it might happen a second time. What bad is it from happening? Nothing bad is, but you have to walk the journey of life. But tena, sio lazima ifanyike tena, sio? Floods sio lazima zirudi tena, but they can come back. When you're counseling, you are open. You don't confine your counseling at the end. These are floods, don't say things that you have no control over. When you are discussing things with that client, you have control over the events. They might occur. Kama nyumba yako ilichomeka na unampasa sababu ya nyumba kuchomeka, would you dare to say haitachomeka tena? You never know. So you leave it open that when such things occur, I am here for you. I will walk the journey with you, but it is my prayer that such a thing does not occur to you again. But let us walk the journey of life, because there are a lot of things zinakungoja ahead to handle. You have a family to take care of, you have a job to take care of, you have the life to live. But don't make promises that you can't control. When somebody has a mental health challenge, don't make promises that you have no control of. Usimwambie hiyo kitu haitatendeka. Oh, na wewe unajua kweli. Usiwe ikitendeka tena atasema sivyo. So say it happened. It is my prayer. It is your prayer that it doesn't happen again. Yes. And then uncontrollable thoughts about the event. Those thoughts will always come. Over the years, maybe they will wear off, but they will still be those uncontrollable thoughts about the event. As a kid of a car, something happened. Or maybe you lost a loved one. And then you're sitting, and you're seeing somebody coming towards you, looking almost like that person. Is it possible? Until I think I really was I'm not uncontrollable thoughts about the event. If things occurred like flood, storm, thunder, run ikapita. Next time before ikikuja, you're in a hurry to go in a house and hide. I don't know where I where you feel safe. Kila mtu anajua mahali ya feel safe. Ndio. Then you think will it happen again? Will it happen again? But you have to live. Utaishi kama sasa huwezi toka nje, huwezi fanya nini? Huwezi kuwa mkubwa, sio? You have to go out. Na kwenda kwa nyumba, utaangalia isinipate under a tree. At least you read about it, you know under a tree is not good for you. Sijui nyumba fulani ukisikia lazima kuwe na net na resistance. Wewe pia sasa unakuwa unafanya uchunguzi, unaangalia, sio? When the person comes to you for counseling, don't tell them it will not happen again. Tell them, take the necessary precautions. Maybe usikae kwa dirisha kabisa, this is the window. Let it not really find you out standing in a pool of water. Just say the practical things that you can do. The day-to-day practical things that you can do. Yes.
There is this funny point that you say on nightmares that back of the days when your mother used to put Bibles on top of the head of the brother so that it's not having the nightmare. And I believe once in a while your brother told you that today I never had a nightmare. What made him say that?
Mom has done something. Or that day was not the nightmare day.
But we can also believe that the relief of the person who is undergoing the PTSD can also help him overcome this.
Yes. Okay. True. If they believe your Bible is well, but you can feel the land, so be it. Hallelujah. Hallelujah. So be it. You have not harmed anybody. You have not done anything wrong. My mom is at peace, kesho ataamka asubuhi aende kazini, my brother pia ataamka aende shuleni, and everybody is happy.
And how can you help family? I have a friend, she's my roommate, and every time she feels sick or something is wrong, like you want to something, she definitely tell me that akienda school, akialiota, nyoka, unasema mwenye utashaa,
Sometimes when we are so sick, sicknesses go to our brains. So we start having confusion, hallucinations, and we lose orientation. So when we are treated, we go away. Mtoto akiwa na fever sana, anajoka sana, what happens? Unasikia anasema nyoka, kwa masikio, ndio.
Kupitia ndivyo atazoti madam.
And then also maybe your friend is has issues with water and water things. It is her maybe. So they give her nightmares. Sometimes nightmares are things. Then we start. We bring them back to them from the subconscious to the conscious. Sometimes the things we worry about. Maybe she has phobias with the water bodies and she's not aware. So if it is a child, discourage them from watching screens. Na unakuta mtoto anawatch, I don't know what it is they watch. I've never understood. Even in the vehicle, you're supposed to interact with your child. But umepea mtoto simu, yeye anaangalia simu, wewe unaangalia I don't know where. You're supposed to, that is your quality time with your child in the vehicle. So unamwambia hizo wanyama zimepita, ni kangaroo. Hapo huku sijui panaitwa nini. I don't know. I thought that is quality time with your child. But unakuta hata kwa matatu watu wamefinyana. Lakini wewe pia umepea simu. What are those things they watch? Cartoons. TikTok. And you're not doing anything, you're just looking. See, I'm looking, and na hiyo ni national park. I'm looking, na hili, tumepita hiyo ni ng'ombe. Sio? I don't know. But that is me thinking. So when you let them watch so much cartoons, when they go to sleep, see wataona hizo cartoons zao. Wataona zingine sijui zinakuwa. I've never been so keen on watching them. But I always have this desire to tap the lady next to me and tell her, hello, talk to your child. Create me time with your child. Because another this is your time to get to know. Mwambie how to handle food yako kujua yote. Sio? As a family. That's a cartoon. I don't know. The young guys. Cartoon. Cartoon.
I have a question.
Yes.
So my kid was involved in an accident a week ago, and most of the time she's like, she has been my child. I'm at a familiar. She followed them in the home, and I was told to ask her to be done. But since she's just there, there are inmates in the shop.
We have pediatric counselors that can walk them to journey. Let them talk about it. Let them hear and tell them that things happen, but just let them be told the truth about it. That when people go through things, accidents can happen. Let them know what they feel. How do they feel about it? How that happened? What do they feel? Let them know maybe somebody else. But what is her fear? Is her fear dying? Her fear getting hurt? Or just the people tumbling? So you can ask them to do the art therapy, know for you what she feels, what happened, and to talk about it existing. But you can also link up with that child psychologist. To walk out the journey of trauma. Zamani unakuta if a death occurs, watoto walikuwa wanafichwa wanaambiwa wasione, sio? But they also undergo their own baby traumas. Sio? So they're supposed to be walked the journey. Sasa unakuta kama ni mama ameaga, sasa picha za mama zimefichwa. kichwa, mtoto asione, asiongelee. No, let them talk about their mom. Let them talk about the positive things about their mom. Let them exhaustively say, mami alikuwa hapa ametunulia lakini mami alikuwa auntie ameniletea ya pink. No. So they talk about it. They have those lovely memories. But if you keep hiding, akienda kuongea watu wakiongea wana whisper, then mtoto akaona hii ni siri. This is something secret. So what has happened to my mom is something that should not have happened and should not be talked about. So, but you have child psychologists who can walk the journey with her as she goes through those.
It was traumatized stress disorder and also be related to anxiety. The reason I'm asking this is, I always like giving examples. I have a daughter, she's now 7 in others. At times I go with her to, personally I always go with her to different institutional different activities or the events where I do some other things.
Yeah, so we have a lot of people online, and I'm seeing some comments. They are saying our voices are low. Yeah, we are live.
I have a child. She's 7 years old. She's actually turning 8 years in August. So at times I always go with her to events. And when people crack jokes, like if I walk or most of the time if I go with her, I don't always stay with her. I want her to interact and do networking with other people. She has her social media account where I'm handling, and there's also another friend of mine who's handling part of her social media account. So most of the times when I drop her and continue with my works, people always crack jokes. She's called away. People say, "It looks like Steven. Can Steven be the dad?" By the time she heard about this, anazisikia watu wakisema msumbui senye ako hapo, atacheka, anakwanga na sura ingine. Ukishona hiyo veins zimepita hapo kwa forehead, jua amekasirika, so watu wanamwacha. But nikirudi naye kwa nyumba, it will take 2 to 3 days. Alafu saa zile usiku tukishasoma Biblia, we do other things. Ananiuliza, "Mami, I want to ask you something." Sasa zile na make jokes with her and say, "What nini unataka kuniuliza?" Unataka tukauliza sasa hivi ni watu wanataka kulala. Ni I need to ask you now, nikiwacha mpaka kesho, I will forget. Ananiuliza, "Mbona kila saa tukienda event, tushaanza friend call video na Filibana ananiambia ati nafanana na nani? Nafanana na nani? Kwani nani ndio daddy? Kwani daddy wangu ni nani?" So like she always asks me some fearful questions, yenye saa zingine nashindwa kumjibu. At times, first tukianza nilisema kwamba kitu ningependa sana kutoka nacho ni pia nimsaidie, because this mental health manuals lazima uanze from yourself na ukuwe na that courage and knowledge ya kujua kusaidia wenzako pia. So kuna hii shida nakwanga nayo kazi, inakwanga na kale kakuoga ile serious. Nimegrow sana na nimepitia lot of challenges. Tulikuwa tukifikia to the extent mtu akinishautia nimecollapse juu ya kuogopa. So kugrow, kuinteract na watu sasa hivi ilikuwa wakati, because nilikuwa na this thing itaniumiza. So nikajiambia nikikuwa kutoka to maybe inaweza mafamili, because sijaipata mtu wake unisaidia on that side. Then for now naweza kuwa hata maybe tuko kwa class kama we are in a certain meeting, then kuna kitu naweza sema that ako kauoga kuna niwe kama sasa inaanza but I'm shaking. I'm shaking na kwamba ile mwoga sana. So I have a friend too mwenye akona nise uoga. Sasa na yeye ni rafiki yangu, ananiambia vile anaogopa. Sasa mimi anataka advice from me
na siwezi confess that even me, I'm in the same situation. You see? So I'm like, how can I help her? I'm really willing to help this lady. You know, na? But at the same time, I still have the same problem. You know, na? Then kuna hizo vitu zimekuwa zimenihapenia before, na unapata it was like maybe it was like 10 to 11 years ago, but hadi sasa hivi kuna vitu zikihappen zinashinda lakini unaona. So kitu ningependa, how can I overcome this kabisa, nipate hiyo courage ya kuongea kwa watu, as in even if I have a song na napenda kuimba, but ninapata I want to sing, but kuna hadi kana nipiga mguu au uona ndio ndio sweat, yani that's how what I feel. Sasa nimesikia leo nimefunza hiyo nikuuliza, kwa hivyo ameleta hivi na sijaijua. So ningependa msaidie kwa sasa, nisaidie nijue pia nitasaidia kwa mfano.
Hello guys. For her, a case is having low self-esteem because of some psychological things that happen, like losing the mom. So what she need to do, like when I was back in secondary school, I was told that if you want to be creative for yourself, maybe the way you say you love to sing, just write that song of yours, take a lap, put it in front of you. Practice singing yourself many times, and then you get the friends that you are very close to, and then present the song to them, and from that you will start building your esteem. Sure.
Maybe as we continue, what happens in YMCA, what is said in YMCA conference, remains in YMCA conference. Kisumu. Are we together? Yes. Are we together? Yes. What is said here remains where? Here. Nisipite mlango tafadhali. Tumeelewana? Sawa sawa.
Okay, this fearless haikueti ni juu ya okay, mimi peke yangu, hata nikiona mwenzako anakuwa discouraged, nimechukua kiboko na chapa mwenzangu, aki mimi nitafeza. Mimi sichapi, yes, but ile kakaka uchungu ninafili kama mimi ndio ninakuwa discouraged, unaona? Na huyo rafiki yangu naye angeona mwingine amekuwa discouraged, yeye hapana. Sasa ni msaada.
I want to appreciate you. One, you have said it. So you've talked in front of us. One step taken, it's a big step. So she has moved one step. And then acknowledging it is also another step. So she has acknowledged it also. Senior. So the next step, link up with the counselor, have a talk, and then the conversation will continue between you and the counselor. Is that okay? And then about you and the young guys, I would advise you, we talked about communication when you were talking. When the children grow up, they don't remain children forever. And we have to have a conversation with them during growth and development. At every stage of their life as they develop, have a conversation because they will ask questions. They will want to know their identity. As much as you pretend and keep quiet, at the end of the day, everybody wants an identity. Like, for example, in the Igbo community, how do people introduce themselves? Aja holding a card, serious. I don't know, wherever it is, serious. That is itself is an identity. When it's the guy, Nyasoba, serious. Anya Kindu, Nya KB, serious. Similarly, Nihivyo. So have a conversation with the child when you walk through the journey of life. As they grow, with every stage, they see different family setups, they see different blendings in families, and they have questions. And you have the answers. Most of the time you have the answers. We are only fearful of giving the answers. So we should know how to camouflage our answers nicely and give them answers. And also, sometimes in life, you can give the identity, but still retain the care of the child. But the girl knows, I never know, but for now, I'm staying with my mom, she's taking care of me, but I come from her. Are you getting me? So you will decide how much. If you feel you cannot make a decision of how much you can give, you can work with a psychologist to help you talk with the girl. Because at the end, everybody wants an identity. You want a name, you want where you come from, you want your age, you want blah, blah, blah. See? Yeah, so that is my opinion about that. And then,
There was a story that she told about a friend who was having nightmares on the siblings. So my question is, I was with a nurse studying at St. Joan, and we were discussing on the relationship between the mentally ill people and the other, this denomination, let me take this denomination of religion. Like they say that there are some mentally people that when they pray to the mental illness walks away, and there are those that they are blessed to be taken to the hospital. So just to confirm, is there any relationship between them? Because we have it with my friend who is studying us and we never came to conclusion.
relationship between prayers and mental health, or conventional medicine. Prayers, spirituality is there, it is a must, it is there. If you love spirituality, if you believe in spirituality, I wouldn't tell you not to go for prayers because you're taking medication. But I would advise you to also come to the hospital for a diagnosis to be made, evidence-based. After getting the evidence-based, start your treatment, but alongside pray. Now, the extent of the prayer is the problem. When you pray and then you feed somebody, you pray and you say for somebody, you pray and your dignity is brought down. Now it becomes one thing. Your human rights are violated in the name of prayers. Then now it becomes a problem. When you're praying and you are confined, you cannot socialize with other people. Your rights are violated. Now the prayer becomes praying. But pray. Even the people who give those medicines, pray. Even me, I pray that my patients get well. Even when I have challenges, I pray. But that does not mean I will not take my medication. When you have malaria, you just go for prayers. Si una mesa antimalarials, that will remember it is positive. Take antimalarials, but as I swallow these antimalarials, yes. I will say we are not healing with prayers, but the way you pray and the form of prayer, do you know what challenge? When the prayer now interferes with your rights, but pray.
Now, I want to maybe talk about you and this issue. I would advise, first of all, you should understand that this thing she's keeping to herself will one day cause a very big mental issue. Because this person is growing, you like it or not, she will want to know who her father is. Never know even her identity. And this child might end up hating you in the future because you will not tell her some truth somewhere. Sometimes it is not easy and very painful for us, maybe because of what we let people let those children, or because of what the fathers did to us. But the reality still remains this person still owns the identity of the person who made you pregnant. No matter, unless you were left and you don't know the rapist. And if you are left and you don't know the rapist, you get to a point that you have to tell your child this is what happened, and I don't know who your father is. And if that child grows beyond the age of 18, without her knowing the truth, she will become, you have taken care of her, you have suffered in her, but she will hate you like you never even knew her, and you never even stayed with her. So the earlier you do it, the better. On your question about praying for people who have such mental issues, most of these church affiliations, like the ones you mentioned, they have realized a method of doing spiritual manipulation. So they will manipulate you spiritually with a behind thing that they want to earn money from you. And before they start manipulating you spiritually, they follow up and research and know where you come from. Mimi nimeleta mtu na brother, nimeleta mtu na V8, nimeshawapelekea kuna mapepo. Hawa sio washaona pesa. And they know very well hapa. Tukiwaambia huyu mtu kuna mapepo na walete mshumaa dunia mzima, mshumaa watatumia kuuza. I can give you a story of this man called, there was a mganga around called Dumba Wadumba. And Dumba Wadumba collect eggs from people. You go there with 5 eggs. When Dumba Wadumba did his job and he realized now he had manipulated people. Squeeze ako na depot ya mayai hapa kwenye. Na aliwacha kuwa mganga. So he used all the eggs, yes. He used all the eggs people were giving him to start selling eggs. It was a very big depot. And people are buying eggs from him, and he used that even what we want to. So that is spiritual manipulation. So the best thing, that's the way she must say, go to the doctors, let the doctor treat you. But even then, they know it's God who heals. So they will tell you they're treating you, but God heals. And I always want to tell people this: there is no channel that somebody uses to go to God for your healing. You have the power, you have the authority, you have the words in your mouth to call God and He will heal you.
Thank you so much. I'm happy you're opening up. Yes. I also feel like opening up. Now, there's a comment I want to put across before I open up. When we are giving comments, remember we are live. Let's avoid mentioning names. Even if it is a church, let's say a certain church. If you want to refer to a person, say a certain person, okay? Or a certain lady. Let's avoid putting names. We can be victimized. And this is also a teaching session. When we are doing this to other people as mentors, when we get out, let's avoid giving examples with names. So, Others, thank you so much for the Christian values. I'm a Christian, and I'm a very staunch one. But what I want to advise us as young people and mentors, first aiders in mental health, let us draw the line. Even in the Bible, it is very, very clear that Mungu alisema everything is medicine. Serious. Si alijua kuna ugonjwa. Na alijua inafaa kutumeza dawa. Isn't it? Let's go to the church for spiritual growth. Let's do health and wellness to our bodies. So. And then let us avoid being brainwashed. It is desperation ndio inafanya tunakuwa brainwashed. Since when were you told that utaombewa upone when you have not taken medicines? They work pamoja. Isn't it? They work pamoja. Meza dawa enda uombewe. But never go to a church or a religion that tells you don't take medicine. That one I say loudly. Yes. You must take medicine. It is biblical. So tuache kukuwa brainwashed. Thank you.
Are we okay up to there? Yes. Can we continue?
Yes.
Sawa. Post-traumatic stress disorder, help can be provided. You apply mental health first aid. We're going to go through it. And also the referral pathway is just like the others. Sawa. Schizophrenia and psychotic disorders. Schizophrenia. We say schizophrenia is a group of mental disorders. And psychotic disorders, schizophrenia mostly falls under psychotic disorders. What are the signs and symptoms? auditory hallucinations. Unasikia vitu ama huwa wanakuja clinic wananiambia ati naona maoni na nasikia masauti, si ndio? Mostly third party. Auditory hallucinations. Hallucinations are the 5 senses that we talked about, perception. Sawa. We can have auditory, tactile, and so on. And then another symptom they will come with delusions. Delusions are false, fixed beliefs that you cannot remove from them. In psychotic, false, fixed beliefs. Akikwambia yeye ni president, sasa wewe una struggle. Si tulikubaliana tusistruggle sana kuwakaza. Some will tell you, I will not eat. You ask them why, and they tell you they have no stomach. Can you prove they have a stomach? As you sit there, unaweza lazimisha ako na tumbo na amekwambia haiko na ni mwili yake. So yours is not to argue that you have a stomach, because that is some of the reasons, like unaona auditory hallucinations. Some of the reasons they are aggressive. They hear people telling them things. So mostly when you bring them to the clinic, it's not like they are fighting you. They are fighting the people talking to them, or they are fighting the people they are seeing. It is never you. Mostly we are afraid of people with mental illnesses. Alafu tunasimama kando. But it's never you that they are fighting. They are fighting the hallucinations that they are seeing. They are fighting the people that they are seeing. The ones that they are hearing. Ameniambia afanye nini? Ameniambia niruke kutoka pa hapa paka huko. Tumeelewana? Yes. So it's never about you. Most of the time it's never about you. Once you understand that, then you can be able to handle mentally ill comfortably. No, it's not you. They are not at war with you. They are at war within themselves. Sawa. Delusions are fixed false beliefs that you cannot remove. Akishakwambia ana tumbo, why are you struggling to insist they have a stomach? That is why they cannot eat. Yours is just to tell them that maybe just test a little, even if there is no stomach, wacha iteremke tu ifike kwa miguu. Atakwambia haya sawa basi, wacha nionje. You have achieved that eating. So you wanted them to feed, but you start them on medications. Sawa. When they have delusions, you give them medications. Then the medications work nicely for such. Another signs and symptom is confused or unconnected speech. Speech huwa inatakikana ina flow. When somebody talks, the tone, the volume, and the speech that they are talking about has to flow. If I was talking about living here, going to Uganda, see the story has to flow. Nitatoka hapa, nitatafuta fare, nikishapata fare, nitapanga nguo zangu na tutaenda na Jane. Tukienda na Jane, tutapanda maybe inaitwa nini, inner coach or coast bus. There is a plan and a flow of how that thing is going to happen. See there? But then there's some, nataka niende Uganda. Na jana, uliona ile nini? Uliona vile alifanya huko? Nani anasumbua siku hizi? You see, it's not flowing. The story was living here, going to Uganda. But suddenly, we have found ourselves talking about Nairobi and things happening in Nairobi. Suddenly, we have found ourselves talking about maybe the legislation that was not brought. Suddenly, we have found ourselves talking about somebody who died 3 years ago. So these stories are not associated and connected. Yes. So you now realize, hizi vitu za nani? As flow, hazishikanishi, sio? There's confused thinking. There's lack of emotions. Sana in schizophrenia, they lack emotions. They can tell you about very sad things. Your emotions are the way you express yourself. Happiness, joy, feeling sad, feeling happy. So when you talk about death, how do you sad? You can even shed tears. But here is a situation, somebody talking about death and laughing. It leaves you wondering, still. Ukieleza vile, like currently we are talking about Albert, the Sindio. And I'm like, alikufa na uliona nashangaa vile watu wanakufanya. You ask yourself, what is wrong with this lady? What is happening? Sindio? They will laugh over something they should not have laughed. When they tell you about their wedding, they're shedding tears. When we talk about our wedding, there are smiles on our face. When we talk about good things in our life, but now they talk about the good things in their lives and they are crying. So the emotion does not correspond with the story they are giving you. It makes you put a question mark on this person. Yes, because our emotions should correspond. When we're talking about sad events, you expect facial body language to talk sadness. Yeah. Lack of emotions, don't make eye contact, doesn't change facial expressions, or speaks in monotony. Schizophrenia, sometimes they just speak in monotony. Increased energy levels, strange, possibly dangerous behaviors. Sometimes they have increased, like in our society, inawaleta kama iliwafunga kabisa. And that is the time we see bringing our brother. Have you seen that? They have increased energy levels because they feel they are fighting for themselves. So they have to fight for themselves. So it needs a lot of able-bodied men to bring them to the health institution. And they sometimes portray dangerous behaviors that don't conform to what society wants. They might want to harm themselves. They might perform homicides, harm other people. They might become suspicious, and if they're suspicious, they might harm somebody else. Like akiwa paranoid, and I suspect you everybody is in danger. Mtu anataka kumuumiza. Sasa utakutana na mtu anatembea kwa nyumba yake toka kwa compound yake na anachungulia kwa madirisha na ni ngoma yake. But anatembea akichungulia, ukimuuliza anakuambia hapo ndani kuna nini? Kuna jeshi kwa hapo ndani na anataka kuniumiza. Sasa lazima mimi pia nifanye nini? Nikuwe ngangari. Sasa kwa madirisha anachungulia ndani na ni kwake. And maybe odd hours. So there are just behaviors that you look at and you realize, no, this person is not behaving well. Sawa. Because when you look inside the house has nobody inside. Or maybe just a child. Sawa. Sometimes they start seeing anaona mtoto anatamba, anafikiria ni mnyama anataka kumuumiza. So that is how they end up even sometimes hurting their own children. Like there was a case mtoto alikuwa anatamba, alafu yeye anasema aliona it was a lion. So he decided to kill the lion before the lion killed him. Sawa. And let us not judge them. Is that okay? Let us not judge them. But let us help them to get help. Sawa.
I have a question.
Yes.
From that illustration. So what happens if they don't get good lawyers? What happens if they don't get good lawyers? Who will understand them? Because unless they defend themselves well, then nobody would even understand they have a mental problem.
Mostly, when they do, when forensic issues come up, then a mental status assessment is done. So they get professional experts to look at them, look into them, assess them, and then stand for them. Yeah. So if it happens, and it is discovered that it happened when you are mentally challenged, then now they become a bit lenient on your case. Under what circumstances? That is when you hear I ended up in a psychiatrist, mental status assessment.
I know somebody maybe not yet diagnosed, but in a way the symptoms the person is exhibiting seems like schizophrenia, but maybe the family or people around don't know, because at times the person has subsequent memory loss, like the person tends to say that he wants to leave and maybe, let's say, go to a faraway place like Nairobi.
Making certain that you maintain a supply of the drug, spending money on the drug even though you cannot afford it, and lastly, not meeting obligations and work responsibilities or cutting back on social or recreational activities because of drug abuse.
Do these signs and symptoms sound familiar? Are they in our communities, in our families, among ourselves? Is there anything we can do about it? Can we do anything? We are going to do something?
Yes.
So, substance and drugs is becoming a menace, but we can do something about it. We are the ones who know where changa inatengenezwa, si tunajua? And we are the ones who hide them, si tunawaficha? Ama we are the ones who inform the law enforcers that the law enforcers are coming, so we inform them and they hide. Ama sio sisi? So at the end of the day, the community has a responsibility. And it is us also whose children are consuming these substances. So it just comes to bite us. If we think of better alternative ways of getting an income and feeding our families, you can put substance aside, because the ones who sell alcohol will tell you anafundisha watoto. Lakini mwenye anauza mboga pia anafundisha watoto. Ama mwenye anauza kiatu pia anafundisha watoto. Does it have to be substance? Does it have to be alcohol? Can we say no in a nice way? Is it possible for us to work within our own community, within the boundaries of the law, and not go there? Is it possible when your problems are so much, you don't have to go and buy alcohol? When you're so broke, you don't have to sell substance. When you're broke, do you have to sell substance? But Kenyans are daring. I don't even want to say how daring you are. Mmoja anashikwa, tunaambiwa changeni pesa tutoe Mkenya. Tena Mkenya mwingine, surely Kenya. Give us a break. Tukishatoa moja, tumelia, anaenda kunyonga. Mkenya sinyongwe jameni. Shilingi yako 5 ndio hiyo. Si tunachanga. And then what happens again? Another Kenyan, just like the other one. And then now we ask ourselves, what is wrong with us? We want fast money, quick fixes, or what do you want? What do you want? Kenyans, we are Kenyans. I don't know. You have the answers. We are younger, you have the answers. What do you want? Can we do it better? Can we make it happen without destroying ourselves? Because at the end of the day, we are destroying ourselves. At the end of the day, we are destroying ourselves. That's how. At the end of the day, we are destroying ourselves. So let us work on it within our communities. If you stop going to drink, anaweza kulazimisha kweli. Si wewe unatembea na mtu yako naenda kunywa. If we stop buying it, and when you buy maybe a fruit, ununue pineapple na hiyo. Ununue uji, unga ya uji, ukoroge uji. Is it possible?
Yes.
Can we try that? Within our community. Don't go fast. Start na hiyo community yako, ndio usome polepole, sio? Sasa, we give it a try. And I love Kenyans, they are resilient. When they decide to do something, they do it. And then when they decide not to do it, they do. So let us work on this thing, small baby steps. Sawa. Help can be provided, applied, mental first aid, then the referral pathways. Yes.
So on that and substance, I wanted to I'm just saying. So on the notes, I'm seeing there like over time, needing more of the drug to get the same effect. I hope all of you know the definition of a drug. So like, let's say you need something like ciprofloxacin to like sleep. You don't just use ciprofloxacin every day to ensure that you sleep. That one I also think is an habit because let's say you don't have ciprofloxacin, what will you use when you want to sleep? So I'm just like trying to say, it doesn't really mean that it should be things like alcohol or banks like the narcotic drugs that have been outlined. Let's say you are using Panadol every day, like you are using it to bed or to like get away from something. No matter how much the drug is helping you, maybe it was prescribed by the doctor. Daktari akakwambia paka hii dawa for 1 week. Wewe unaona dawa imenisaidia sana. Acha nitumie for 2 months. That one you're also abusing the drug. Not even at that time, but maybe at a particular point later, it's a challenge. Because for every drug, it is meant to be used for a particular duration with a particular prescription. So let's not only focus on the outlined narcotic drugs, but you should also use other drugs when it's
Ukikuwa usingizi, ukikuwa Piriton, si ndio? Nipatie hiyo Piriton yangu moja, alafu dawa nipatie mbili, ndio nilale. Na kulala hiyo ni side effect ya Piriton. Aswa kazi yake ni allergy. Allergy is supposed to be Piriton, anti-allergy, si ndio? Lakini kwa meza na lala, and then what happens? We abuse, si ndio? Yes. So let us stop abusing even other drugs. Viagra is used for treating what? Erectile dysfunction. Heart disease. Even women take the blue pill. Do you know that? Do you know its main intent was treatment for heart disease? But somebody somewhere in his wisdom discovered something. The rest is history. The rest is history. See there? So when it goes there, it goes out of the heart. Anyone? It doesn't spare the heart because that was its original work. Like in our wisdom, we discovered something.
Since it was meant to work for the heart, and the person is not taking it for the purpose of the heart, is it still working on the heart or it is affecting the heart?
You tell me.
Because now the person who is taking it, because now what people are doing, they are using the drug, and the purpose of the drug it was meant to work on the heart. Could it be the reason why some people who take it will collapse during the act or die in the midst of the act?
I believe for the drug abuse, it also communicates with, for example, in a facility, you as a nurse, those drugs that only need to have a prescription, for example, morphine. I have a nurse who, there is also a rehabilitation center in the facility, but because of the stigma, they don't want to receive that no, you are also an addict. They don't want that stigmatization. The correlationship with their work and the drug they are using, now they are, in other words, they steal the drug because they can prescribe it for themselves and go to the lab and go to the pharmacy and take the drug for themselves. Even if you advise them to go for the rehabilitation in order to prevent the drug abuse, they will avoid it. They will start for a while, for a period, and then because no, this, and then in the rehabilitation we also have the students. Students talk, we talk, and there is nothing you can do about it. They will say, no, there is no confidentiality, there is no privacy for me in here. So let me just go back to the drug because I want the feeling that I always need, that is to feel better. I don't want to feel the pain. Some have the cysts, the fibroids, and they need the drug in order to feel well, and they also avoid going for surgery because they are scared. They've seen what happens in the theater and they are scared. They don't want to go. Now, how do you deal with that patient?
A healthcare provider on substance. On substance. A healthcare provider on substance. It is a menace. It is among stigma and discrimination. Well, zamani, who believes daktari anaweza kuwa mgonjwa? People believe kama wewe ni daktari huwezi gonjeka, si ndio? And yet, we saw the risk factors. And healthcare providers also from communities, and are they also susceptible to the risk factors? Genetically, the environment they live in. So healthcare workers also have their challenges. The only problem that adds to their challenges is that they have access to those drugs. Most of these drugs that people use to abuse are drugs that are used, not that they came from nowhere. They are drugs that are used within the hospital setting, within a given dose and a given time. But now the healthcare worker will abuse it because Akona access to it. But they also need to be assisted. If we remove stigma and discrimination, when a doctor is admitted because he's a drug addict, how do the other patients look at him? When I admit fellow staffs to mental institutions, the patient mother the courageous one asks, no, I know you to here. So it's like a discrimination. So that stigma and discrimination bars healthcare workers from coming out and saying, we have a problem and we want to be helped.
I think I'll give another example. The same way like if a pastor
Seems it looks like he has had the worst sin on earth. But a pastor is just a normal human being, blood, flesh, and everything, with all the feelings we all have. The only thing he has just that title, a pastor. Because even he just got that title and say you are a pastor. But the reality is, what we eat, that is what we eat. Where we walk, that is where we don't live in heaven, we live on earth like us. So it's the same thing, it happens to them. It's the thing that applies the same. People take it like doctors are so, they are in fact for them, they keep them sick. A pastor should not sin because we talk about sin. In fact, what falls, breaks down most pastors is sin of humanity. Hiyo sasa ndio ukiona mwananga pastor vision, huyu alishalala na huyu. But the reality hakuna feelings kama human. And the same way with doctors, they are also human flesh and blood. And the same way amemtibu, hata wewe unaweza kuwa umefanya mpaka hiyo ugonjwa. Because they interact with us so much. The same way a pastor will also be influenced with a praise and worshiper who comes and sits down with a short dress in front of a pastor, and pastor is a man. That is the same way you talk a flu and be a doctor kwa sababu amemtibu na apate hiyo. He can also get the flu and become sick. So they are also vulnerable the same way they are also vulnerable.
Does that answer you? That as human beings, we are all susceptible, we are all vulnerable.
What I've been saying, what about the manufacturers? Because we have the government take medicines in pharmacies and doctors are just giving the prescriptions. So let's not look at only the other side. we also look from the government side because we are the manufacturers. You have seen on social media as well in the Facebook. Everything nowadays is counterfeits. Even the alcohol, even those medicines that you are seeing that are there, they are not better. They are counterfeits. Yeah. So mostly that's why we're in a country where people are faced with mental illness. Even leaders, you've seen the leaders. Yeah, it's excessive, but mostly it's the government because they are manufacturing and they don't want to accept the fact that counterfeits would fake medicines.
Are we okay up to there? That we are all susceptible, irrespective of our profession. The only difference with the healthcare worker is that they have access. Yeah, but it is a menace. It is a menace. And we need to come together and assist each other. So we should remove the stigma, the discrimination. If you see a doctor having a problem, if you are within a community, please just give first aid the way you give to anybody. Don't look at the title at that point when you are giving first aid. Are we together?
Yes.
That we are giving first aid to the community, we are giving first aid to a fellow human being, we are giving first aid to somebody who needs first aid. So we will not discriminate whether it's a healthcare worker or not. If there is need, advise them, healthcare uwezo wako, mahali they should go for referral. Mental health first aid. Before I continue, I want to acknowledge the presence of my friend. She can say hi and then.
Thank you, Julia. Good afternoon. Good afternoon once again. Happy to be here. I see there is a lot of positive energy. My name is Faith, psychiatrist. I'm based at the Kisumu County Referral Hospital. I also coordinate mental health services in Kisumu Central Sub-County. And I'm here with the blessings of the MOH for Kisumu Central Sub-County. Thank you.
Thank you, Faith. So let us continue. Mental health first aid. We have talked of mental health first aid. We are first aid. So this is the help we give to someone developing a mental health problem, experiencing a worsening mental health problem, or in a mental health crisis. These are the people. Serious. Somebody experiencing a mental health problem, maybe hajawahi kuwa na mental health, but it's the first time they're experiencing a mental health problem. Maybe it's somebody on treatment, experiencing a worsening mental health problem. It's somebody on treatment, ongoing treatment, but it is getting worse. Serious. And then, or in a mental health crisis. Mental health also has emergencies. So sometimes you can be in a mental health crisis. So crisis is anything that overwhelms you beyond your usual way of handling it. So what are the 5-step actions planned to help someone developing a mental health problem? We have something to do. We have a role. Can we help them? Gender, a gentleman will do it for us. Any volunteer?
Five-step action plan to help someone developing a mental health problem. Number 1, assess the risk of suicide or harm to self or others. Number 2, listen without judgment. Number 3, give reassurance and accurate information. Number 4, encourage the person to get appropriate professional help. And the last one, encourage self-care.
within our community, as mental health first aiders, are we able to assess the risk of suicide or harm to self or others? Are we able to assess the risk? How would you assess the risk? How would you assess that this person is at risk of suicide or harming others? Within a community.
Basically, you find most of them, if they find like a sharp object, they want to try to tell them on their risk. Some of them they follow the way they just handle the road. Any mistake.
Somebody else also who thinks how we can assess the risk. How do we assess the risk?
Thank you. We can assess the risk by if we can monitor someone who was active maybe in the community, and you find the way he used to do things are changing, and now he will not actively participate. I think that's how we can assess.
Somebody else who feels how we can assess the risk for somebody who is going to harm themselves, because most of the time we tend to go have an idea, isn't it? So we are the same sort of community that says, actually we do it, or we don't do such work. Actually it's the honor, with the honor you. Those are the risks we have to work with.
If you have somebody who is making, let's say, jobs similar to suicidal jobs, you are with a friend, or maybe the way we are young, somebody is saying, you just wait. One day you'll find me dead, and then you will be shocked. Like some similar jobs. Yeah.
It's verbalizing about it.
Also, you observe the behavioral changes of this person. Sometimes maybe they talk about things that they would want to do, things that they have watched, for example, in movies. They'll say, I'm going to cut my wrist and see what happens.
Somebody who has been watching movies, yeah.
I think maybe we can also look at the physical inputs they have in themselves. For example, marks on the wrist and stuff like that.
Physical things they've done on themselves, self-harm, serious.
Being that these are the people that we live in the community, I believe that we know the difference of people we meet around in the community. Some other people, if you want to see that there are risk, maybe somebody who have been happy, just becoming stressed. So as mental health assessor, you should notice that this person have not been stressed, but now he is. So you should go to him and ask on what is wrong with him, and then from the explanation on how he will be talking, maybe you get points of him relating to the risk that it's not right.
I think also maybe you can see someone walking around the way they cross the road, being in risky places, maybe too close to dangerous rivers, or maybe the bridges or maybe the hills or the outbreaks, something like that.
He's saying somebody who is living sort of almost a reckless life is not mitigating against any danger. They're walking across near the river, then just walk on the riverbank, walk on cliffs, and they don't mind. Those are somewhere.
Like now, there's this issue of social media. There's others who they can't express themselves. Hata ile kuongea, they just keep quiet, but unaweza pata wamepost kwa social media handle zake, like there's a boy na certain university
unanitupa ndani ya swimming pool. To follow up, he had posted in his social media the plans of him committing suicide. So some people that you can find access through their social media platform.
They are many senior. And they know that death awaits everybody. And they meet death in their kazi yao hii ya health. They meet death every day. Unaingia kazini unakuta people have died. Whoa, 7. Hey, now this number. So it becomes like death is iko karibu. Unaelewa? And there is somebody who saw one akakaa 5 years. Ndio akarudi tena akaambiwa shosho nani amekufa. Shosho nani amekufa. Ndio unaenda nyumbani kuona. But ukiingia kazini this one I had again. So it's something that it does something to you. Yes, that is just one of the stories. Faye can say another story of healthcare workers and mental health issues. The stigma, the discrimination is there. If a doctor tells you, I have depression, na wewe pia uko na depression na unataka kuona na yeye pia ako depressed, sasa nani ataona nani? Na workload pia iko. Because the supervisor wants them to work. Wapi nani? Hajakuja kazini. We've never had good policies for healthcare workers. Issues mental health. Ukienda kwa ofisi useme niko na depression, nimekutana naye amepata anaota jua kwake na hajakuja kazini. That is the picture we portray. So we don't feel that shida yake is really a problem. Hata wewe you have the audacity kuenda chini ya miti pale amekaa daktari. Habari yako? Mimi ni mgonjwa bwana, mbona umetulia tu hapa? Na it is at a point something. Maybe even on medication, sio? Will we leave them alone?
Thank you, Vivian. I think you have said most of the reasons, but first, again, the healthcare workers are human, just like you and your neighbor. So we are also human. Whatever you go through, we also go through. We don't live in a separate world. So whatever environment you are in, we are also there. When the taxes are very high, it is even worse for us. So remember, mental health is respect for status, for profession, for gender, nothing. It doesn't respect any of that. So it could affect anyone, regardless of where they come from, what they do, where they are. So first, they are human. Sawa sawa? Yes. The other thing is the stigma. You would really not think that they would go through mental illnesses, isn't it? And because they go through that, no one will want to come out and say they are going through that because of what the society and the community expects out of them. So, of course, people will hide under the kabatis, like Lilian is saying. So, because of that, it is even worse. And so no one will want to really come out and say they are going through something. But remember, first, they are human and they go through everything else that others go through them. And now the stigma worsens the situation. But currently, we thank God, we thank the systems that these things are now becoming, common, that we can now speak about mental health and we can now get out of those corners where we are hiding and talk about it, just like the society surrounding us. Yes, so don't fear. Even when we say look for them, still look for them. Even if when you come to me, I'll not be able to help you, I know I can direct you to someone who can help you.
Is that okay? Yes. The nature of healthcare working is not easy. Duties like night duties are not fun duties. Duties like going to theater and opening up abdomens and seeing stuff are not easy. Duties of taking care of people with chronic diseases. You see a cancer disease and you wonder, if that stomach looked like that inside with that growth, what about mine? You'll be traumatized. You keep asking yourself, am I safe? Is my stomach okay? Could it be? Could I be having that cancer? Is it developing and I don't know? Are you getting it? They are also human. So you get concerned. You've gone in, opened up an abdomen and seen stuff that you ask yourself. Even when you're carrying a pregnancy and you see all those abnormal pregnancies, what makes you think yours is not good enough? So you ask yourself, na mimi pia nimebeba kama ule mama. Hey, hii yangu, is it okay? Will my child be born like this? And
Okay, I have a question. Mentally here for her or for him to heal, to fully heal from it. Inachukua muda gani? Unaweza pata mtu already, so and so ako na hiyo shida, then mkikaa hapo zinaweza na wewe kwani hii just move on. You see, kuna wale wenye wanapata mtu hajali, unaona, kama you are just there and you are not even putting any effort. So how long can it take kama huyu overcome this?
She's asking, how long does it take you to heal from mental illness? And we said we have a number of mental illnesses here, different, and we have risk factors, pia mingi tofauti. We have factors that perpetuate, that sustain the mental illness, like poverty, extreme poverty. It will perpetuate the mental illness. So you cannot say it will take this long. We have factors that you had a mental illness, things were going fine until the breakdown of the family dies. See the precipitate. You are doing fine until that person who holds that relationship disappears. Where do I don't know where it disappears? With that mental illness now, you have a mental illness that is genetic.
Okay. I'll say it depends with the type of illness. There are those illnesses that people recover from, like depression, like an acute psychotic episodes. People can recover from that. But majority of the conditions are chronic. That means you live with them. You just manage them, and most of the time you have cure, but they are manageable and people can be productive living with them because you are managing them. So in such a case, you cannot tell when it will end because it is the nature of that condition that it is a long-standing one. One can live with it for a long time. There are those that will resolve for some time, but when another trigger comes, then you get another episode. So it will depend on the condition. It will depend also with the support that you have and the risks that surround that condition.
Oh. Mental illness is not one thing, it does not work alone. There are many axes that you look into as far as mental health is concerned.
I have a question. Is there any some mental illness that cannot be sustained or managed?
A mental illness that cannot be sustained or managed. What is important, we remember how we define mental illness, that you can work productively and fruitfully and contribute to a community. So if somebody can work productively, might not work as productive as you, and is not as fruitful as you, but is sustained within community and his behavior is tolerated within community. But there's some mental illnesses that are chronic. just like hypertension, diabetes. They are chronic, but they can be contained within society and they can be maintained on medication. Then they will continue. They have a number of men, in fact, a number of people have mental illness. You'll be surprised. Even the politicians you look at and smile, they have mental illnesses and they have families, they're sustaining their families, and life is going on. They might not produce as much, but they're producing enough to sustain the family, to take care of their family, and they have come to accept themselves that way.
In a state where somebody cannot do anything, it's just mentally challenged. Nothing in the room can do, nothing in the room. The work is only to walk door to door, making stories, just false stories, not even the correct ones. Just walking, doing nothing. How can that person be?
Is there medication as she? Has somebody taken a step to take them to the hospital to be assessed? Have they been started on medication? Are they seeing a counselor? Are they seeing a psychologist? What have you done? Or do you umewacha tu inaenda tu hivyo without the social support that they're supposed to get? So what has society done? Are they on medication? And they are not getting their medication. Some. But Faye can also tell us this a lot.
Yes, my answer is yes. There are conditions that people become very unproductive, and one of them is schizophrenia. Most of the time, people are not very productive because the nature is chronic, meaning it is a condition that you live with for the rest of your life, and if it is not well managed, but when we say well managed, we mean medications, follow-up, support by the family and the community around them, and can these people do something that makes them feel like they are part of the community? That is where they become productive. If they cannot, if those factors are not there, then they will behave the way you are saying. But if everyone who has a mental illness is managed through medications, consistent follow-up, and is supported by the family and the immediate society, and then they are empowered to become productive or to become a bit independent, then they can be very productive. Yes.
Are you? Okay. Yeah, they certainly have a lot of challenges. Most of them don't have IDs. Most of them don't have shares. So your work is cut out for you. As you say, you're going out to have mentally ill. I want a vitambulisho. I want a share.
Praise God. Actually, I don't have a question, but I just want to talk on what she's saying. First of all, there are those maybe now we just check on the factors that cause it. We had biological factors, environment. So if you are born with that, maybe it might not be cured, but managed. So if it is passed through, let me say, generation, then what we have to do as a family or as a group of medical crusaders, we just help the people understand the situations and then refer them to the right places that they can get medication. Thank you.
Okay, I have a question. I'm a trainer and I will be here to us trainers. You have a situation in a class, and I want to talk on the situation of the fear that she talked about earlier. You have a situation in a class where you have a trainee who has that mental issue of fear because of the trauma maybe she went through. And you have a trainer like me, and it is so difficult for me to change. I've tried and God will give you the grace that is in you. And you see they're laughing because they know. So this training, you are trying so much hard because being that I'm also a counselor, I told them that at the end of the day, I'm the first person this training maybe will approach talk, and then she keeps coming all the time to talk, and then you realize she's also my trainee in my class. So anytime I become who I am, then we start we talk. Now because I'm now the next friend, she has to come and tell again, you see, madam, you know what? You know, when you just talked today, again, because I didn't even if she's given back to maybe a different and someone will still trigger it again, and we will keep going back to it. And personally, from maybe the guardians, I've just realized that they have done this and spent even a lot of money on this. It's not about here. They have done this, they have spent money, they have even paid counselors over a lot of money because of that training. That is not improving over time. And then she has also a counselor who also spoke. The teachers are the class, and the teachers are the beauty problem. And then the next time I'm put up a class. Okay? Yeah? Is it possible? So it means that it is best to get an external counselor because the teacher will still trigger my fears. Maybe some of my fears generate from a previous school experience that I had, and I might not come out and say it. So, in my opinion, what I usually say when I go to schools is that the best counselor would be somebody who does not know you so much.
This is somebody who, even because of that, she dropped in secondary. They tried to take him to another college, she dropped because of that. They took to another college, she dropped because of that. This is the third college. Now the person is now in. This is the third college, of which she's already threatening to do what? To drop. And they have used all the money they can, they have even done those internal road. She decided now she doesn't want to go and see the counselors out. She wants the counselor to come at home. The counselor has been coming at home. Now the counselor coming at home is also a bad one. I don't want that counselor taking me to Russia. She's taken to Russia. The counselors at Russia are very tough. So they are wondering where do they put her now?
Does she want us to relate to those trainings or that education? Or it is a trend that we have said, mtu lazima aende shule, apite shule, aende college.
She even asks for it. She asks for it.
For it.
Yes, she wakes up and says, now I want to go. And she's taken there. Within 1 week, 2 weeks, I don't want to go.
Let's the psychologist.
I think this student could be having a problem that is not yet discovered. Yeah, so she needs further evaluation by a professional. Yes. You see the patterns. Has been to school, dropped out, went to another, dropped out, went to another, and this could be the third one. So it means there is a problem. Yes.
So maybe you can involve our psychologist here. Or the person just needs to be studying why she doing this. Maybe it is her defense mechanism. Maybe she's beating back at the parents. Maybe they've never been there for her. All this will be explored when she gets a psychologist to explore all this. I can probably say I want to go to college. But at the back of my mind, I need this one. I want to be this man who was never there. Kila siku akitoka kazini anaenda kwa saluni yake, anarudi saa 4 ya usiku, anakuta nimelala, nikiamka asubuhi kama mtoto, mami hayuko, lakini aliwacha shughuli kubwa hapo, ameniwachia vitu nzuri, ameniwacha na house help. House help is the one who will teach your child a culture. Na atafundisha yeye culture yake yenye alitoka nayo kwao. So it means your mother does not know you.
and you don't know your mother. And you don't know the values that your mother wanted to instill in you. So we sure when you grow up, you will assume that you grew up with integrity. But you grew up like the house help. Kama house help, grew up kama wanaiba vitu kidogo. Unajua kama mtoto yako atakuwa anafanya hizo vitu. Because house help can bring up, sio wewe. So maybe the child is sitting back at parents who are busy looking for money to try to make life bearable. That she may have her own bedroom. Akwe kwa 4-bedroom house, kila mtu na bedroom yake, akigombezwa anajua go to your bedroom or go upstairs. Unlike when akigombezwa anajizungusha tu hapo. So it's something deep. Most of our stories begin within the smallest unit. And which is the smallest unit? The family. Most of our stories begin from our family. So here we need somebody to explore. Maybe anasema anataka college, you will see anataka college. That's what they want to hear. Nikifika huko niwaambie sitaki, sasa watafanya nini? Wacha nione. Now that I'm older, when I was young, maybe they used to just push me and force me.
Even as we speak, she doesn't want to go to college. She wants a teacher to be picked from the college or a fellow student to be teaching her in the house.
How many children are there in that family? So please explore, and where have the parents been all along?
So we're finding out is the mother went a long time ago, she never visited her mother is, she was staying with relatives and blah blah, so many stories, but now the person who is taking care of her, she claims she has taken care of her in the best way she could ever imagine.
The best way is just having your mother eating ugali na sukuma wiki.
So she has given her the best, more than even how she did.
So we should know that the most important unit, the most important place for our mental health growth is the family. That is where the story begins. So you might think you are given the best, but the best is not best enough. The best for a child is you. As you eat school and you say this is what we could bring, but we are here eating it together, spending quality time with the children. Yes, and that the best is teaching them how to kick a ball. Now, ball here imetengenezwa na Duala. How many played those balls? You remember those balls? Yes, as we grew up with those balls. I mean, I didn't know they were bought in the supermarket. I knew when I was very like, oh, you can buy them in the supermarket. We used to get them to go to the outside, pick those like. And the bigger your Duala, the more say you have. When they say something and you don't like it, you take your Duala, put it in your hand. And they bring you to come back. So the family unit matters a lot. When somebody at old age or slightly older after the challenges, look into the family unit. The family unit speaks the story of individuals. Because that is where our primary socialization began. Yes.
And the girl we are talking about is the best friend I told you about. She's my best friend, and she's very, very kind. And I love her so much. So ilivyofikana inashika okay. Even when I went through a lot, nimeishi na watu different people. Nimeelewa na Kikuyu, Mungu, Kisii, nini kama nimeishi na watu. Sasa shida iliyoweza nijaribu kushauriana nikashindwa kabisa. Ndio hata tukiambiwa wewe hebu shule kitu weka huko. Hiyo ni kazi tunapiga. Umeona kwanza chukua hiyo kiti uende kwa kiti kati tulizi. Mimi nafanya hivyo ili mniache niende place. So I'm like, my friend, that is not just taking that seat from there and put it there. Haitakuharm, it won't harm you. Unaona? Ni kama nilikuwa ninazama na kuambia nimefanya makosa ya nijisikie vizuri. So the discipline is not that harsh. Nimefanya nasema that this is harsh for me. Ama kuna ile mtu anakuface direct. You can say that mimi mwambie kila wakati niliona, so you can see hatimaye kama nilipelelea. So hiyo ndio pia ninajaribu. Kama unaelewa sasa nikalia kazi. That is a very petty punishment, even as a shame of her.
So the challenges, and especially in upbringing, when I say upbringing, even institutional upbringings have their challenges.
Mimi na rafiki yangu baba kila wakati anakaa analeta vitu na kiasi cha kufanya maisha kuendelea.
He has a friend, substance use disorder, and is not productive. Bottom line. What can you do for your friend to be productive? Somebody using substance and is not productive. What can you do for your friend to be productive? Is he willing to be helped to be productive? Is he willing to be productive? Because the story is with him. Actually, the social supporters. Is he willing to be helped, or is he comfortable in his world of Niadarati? Does he want to be helped? And if he wants to be helped, is he ready to walk the journey of being helped? Because mental illness, until you cause society, you can walk around and do your own things. Now, what around you as a booker, that is your thing. How you cause society. Until you even this year when the mama kibanda, then society will beat you because you are stolen from them. Unlike physical illness, mtu amekatika mguu, si watu watampeleka wamlete hospitali ya shule. So the challenge with mental illness is the way their entry point into institutions where they can be assisted. If it's using the additiction, and mostly mental illnesses or mental challenges come with conflict with the law. So siku ile atashikwa sababu ya mihadarati. Now the mihadarati story will come out. But we know if he takes it and gets away, there is basically almost little we can say ametukosea, but he's not going in the right direction. He needs to be assisted. So he needs to first step. We are going to read about these first aid steps. Identify that he has a problem, let him accept that he has a problem, and tell him that I know of a path how you can be assisted. My friend, I've been observing you, you're 23 years of age, at 23, growth and development, you should be doing 1, 2, 3, 4. If you're not doing 1, 2, 3, 4, my friend, you're going in the wrong path. So I'm advising you, let us go to the hospital that you may be assessed and that I assist you. I will hold your hand, I will walk the journey with you, I'll be there for you. And if you say you'll be there for them, even when you want to go somewhere, you will be there for them if you promise to be there. That is the journey that you can walk with them. But you cannot force them to accept they have a problem and they need to be assisted. Because hawajakosea society. That is the mistake we always do. Bundle our brothers, especially the boy child, when they're using substance and alcohol, and then take them to a rehab, lock them there, and make sure they take their 3 months there and pay everything and leave them there. As far what we are doing is taking a break. Because wametuchosha wageni wakikuja, we feel ashamed of them, blah, blah, blah. So we lock them in the name of ameenda rehab. But yeye mwenye amepelekwa rehab, he's 35 years old. Ukimuuliza, what do you think about rehab? Anakwambia si hawa walinileta. So to him is not, so the first thing, let him aelewe kuna makosa. Naelewe anataka kusaidiwa. Naelewe watu wanamsaidia, their supporters, they are walking the journey with him. But so long as wewe ndio unampeleka, wewe ndio unalipa, unamwacha huko 3 months, anakaa huko, akimaliza 3 months atarudi kule alipokuwa. It's all about you. It's all about their mental state. It's all about them. Sasa, it's all about your friend. Telling him to hold his hand. Telling him to take him to where he can get help. Tell him how to walk that journey.
Atatumia ama matumizi, lakini atapatia wakati.
He's aggressive, whether he has used or not. Tell him being aggressive is not okay. Tell him the no. Let him beat somebody. then somebody will take him to court. Because if he wants to be aggressive, what can you do about it? He has opted, this is what he wants, serious. He knows the law. He's above 18. Mental illness and the laws na collide sana. There are forensic issues in mental illness. So if he's aggressive, tell him the consequences of being aggressive. Tell him the consequences of being aggressive. If he feels he's strong enough, anaweza piga mtu akaua mtu. Those are the consequences. Akahaa mtu. Huyu mtu atapeleka kotini, sio? Tell him the consequences of being aggressive. Somebody can also hurt him. The price of being hurt, the cost of being hurt. Let him see for himself. But if he feels he's gaining more from his substance, there's almost sometimes and sometimes you can harm your, strain yourself to assist someone. Mpaka wewe mwenyewe pia unajikuta you are going down with him in the process of trying to help him. So you should know the boundary of helping. You should know where the boundary is of helping this person. You might try to pick your friend from the pit. Now you pick away here. Your life is not moving. You're not going to work. You're not doing anything. You're not being productive. All you do is chase Bashir all over town. Where is he? Where is he going to be aggressive? When he fights, you try to block those things. And you end up maybe with a broken jaw when you end up seeking treatment. Yes, I know about who are aggressive as you're seeking treatment. So you should also know the boundaries.
I have a question on the same subject. The law says that there is voluntary admission and involuntary admission. So why is it that we have to, in the hospital, whenever now if the person is my relative and I see they are now having people in the society and I have an idea this is a mental illness, I take them to the facility, they admit it involuntarily, and they say that in therapy, the person has to accept they have a problem in order to get help. So why is it that the facility will now take them in and try to help them? In case, and in that state, they are not willing to get the help and they are not even willing to say they have the problem. Why is it that now we have to follow the law and the facility has to take the person in? They will not have the challenge of readmitting the person because whenever they are out of the facility, they go back to the society, they interact with society, they are taken back into voluntarily.
Let's talk about the law and the acts, mental health acts, the admission.
Yes, before I go to your question, I also want to respond to your friends, your concern about your friend. So he's aggressive, he's always picking fights because those are effects of what he's using. He smokes weed, marijuana. Those are the that is as a result of what he's using. So if he stopped using, he will stop getting aggressive, he will stop getting irritable and fighting with everyone. Yes. To your question, the law allows facilities and healthcare workers and mental health professionals to admit people who are not of sound mind involuntarily. This is because at that point they're not able to make sound judgment. And while you're doing that, your intention is to help, not to harm. So the law allows. We don't go against the law. And by the way, the law protects the mentally ill people, population. They are very well protected by the law. And they have their property, and they have rights. If they're not able to make that judgment or that decision, someone that they choose, and by the way, at that point, because of the nature of mental illnesses, they're not even in a position to see that the people taking them to the hospital are doing something good to them. But this, we don't decide by ourselves, their relatives decide, because even when they come
they are brought to hospital, it is the relatives or the community who bring the people to hospital. But the law allows that involuntary admission and so there are many forms of admission and voluntary where you feel you're not doing well and you go to hospital and if the healthcare provider feels that you need to be admitted, you are admitted. That is voluntary. Then there is that involuntary admission where you are sick, you are not able to make that decision or that judgment, and someone brings you or takes you to a hospital involuntarily. The other form of admission is uniform. You see the police officers, the army, you don't just admit. There is a law that allows you to admit them, and they are not admitted anywhere because that is a very sensitive population. In their unsound mind, they might give you a lot of secrets that belong to the government. So they are not admitted anywhere. There are those places that are admitted in air. Yes. So the law protects people with mental illnesses. So we don't just act, we follow the law. Is it time? Yes.
Between us and lunch, this is what is standing.
Yes.
So you decide.
Okay, guys, we are talking about now we request us to stand up together.
We want to go for lunch. Yes. I think breaking for lunch with that person.
Can we complete this or go for lunch, come back and continue from here? We go and come back. Well, majority, we go for lunch and come back.
Yes.
Sawa. I need to hear it. Yes. Sawa.
So cold and you want to see somebody to pray for us. Then people to live in we are late. We have a very short session, I don't know, after lunch.
So we
Yeah, okay. Timekeeper? At 2, okay. So who is praying?
Smile. Acha tu.
We have a lot of population around. Don't leave anything sensitive. You want to leave your phone, your battery,
Mimi sijui. Jana wewe.
Kuja bado. Haiko hold, hii kitu haistop. Ni full time mpaka saa 11. Na niwe itatoka hapo na mimi sina hiki.
C. So C, and then O, and then N, and then T, and then U, and then T. Na tunafanya haraka. So hakuna kuspell, tunaanza yani tuna say it now. Let's do it. Let's go.
Coconut, sisi. Coco, ya. Ningeshangaa kuna si bana.
And then
Rudie. C O U C O N U T. Coconut.
Good afternoon.
Jiji. Iko kopile chaji.
Ya kwanza, ya pili, ya tatu. Let us move very fast now. Now that we have conversed issues so we move very fast and minimize the questions so that we go home. Sawa. So the second one is listen without judgment. We are talking about 5-step action plan to help someone developing a mental health problem. We are going back to our community, and we are going back with knowledge, and we are going back with the certificate. So the next step is listen without judgment. Mentally ill do not like to be judged, do not argue with them. You tend to want to argue, there is this desire to argue, kitu nakwambia usende, sio? We are here to remove the visuals tunakwambia tuwaambie hivi. Sawa. So we listen to them without judgment. Sawa. We avoid arguments and confrontation with a person with mental illness. Give reassurance and accurate information. Sometimes they get a bit confused when they're in that mental state. Give accurate information. Anakuja alafu anakwambia wewe ni bibi yangu. Alafu wewe unajibu ndio because you want to get away with it. That is not the answer. Is it accurate? Are you the wife? Alafu tamwambia ulikuwa tu mgonjwa ndio ukajibu hivi. Give accurate information. Do not think that because they are mentally ill, they do not understand. You can be mentally ill, but you understand what is going on. So even if you are giving medication, explain to them, I'm giving you this medication so that it can help you to allay this anxiety that you have. I'm about to inject you because I want to assist you through the injection. Tell anyone, I would like to do this, whatever you want to do. Tell them accurately what you're telling, what you are going to do to them. You should let it come out that you are in of talking to them or interacting with them is to help them. Lengo yako ni kumsaidia, sawa sawa. Reassure them that you're giving the best that you can and give the best that you can. Sometimes it's very demanding to handle a mental need. If somebody with mental problems, it's demanding, it demands a lot, but give it your best shot. Sawa sawa. Encourage the person to get appropriate professional help. So we talked of professional help. We talked that the prayers are there, but Madam Pamela handled the issue of prayers. And the other lecturer also talked about the prayers. There should be a limit and a balance. Yeah, prayers are not bad, but there should be a limit. But take your medications. Medications are also okay. Luke was a physician in the Bible. Yeah. Encourage the person to get appropriate professional help. Encourage self-care. Encourage people to get enough sleep, get a diet that is good enough for them, locally available foods, a healthy diet that contains locally available food. When they talk of healthy diet, somebody thinks, oh, lazima ikue nyama, nini. If it is there, have it. If the eggs are there, if omena is there, serious. Yes. So let us get a healthy meal. That is when you're in encouraging self-care. Regular exercises, relaxation, avoid alcohol, such like things. Sawa. Alcohol, really alcohol. We have benefits. If we carry out mental health, we have benefits. Does it come with benefits? Or is it avoid? It comes with goodies also. Serious. What are the goodies? Mental health is important in every stage of our lives, which entails increased self-esteem. When you have increased self-esteem, unajisikia wewe pia ni mtu kati ya watu. Serious. Ukiongea wanakusikiza. Improve social interaction and relationships. Life is all about interaction. You remember the definition of health. And we talked about physical, mental, and social. Always remember the three zones of health. Physical, mental, and social. So, improve social interactions and relationships. Whatever the story, you always need to socially interact. We are taking it for granted, these social interactions. But there are some countries where some of their biggest problems are loneliness. Nobody comes to visit, nobody says hi, nobody cares. Since we live in a society where in fact everybody's business. Tunapitia kwa roho hii njia hii ya kando kando kwa shosho fulani, si ndio? Nenda simpasi unamsalimia. Shosho habari nzuri, umelala poa, umelala poa. You know, those are just social interactions. As much as the wire was not officially open for you to pass through, but you have at least said hi to your fellow person, you have interacted, sio? Hata anaweza kukuambia, na jana ulisikia ile ilikuwa inafanyika. Alafu mna socialize kidogo. Ama mjaona kama hizo huko kwa village. As you are passing, even welcome to you, those are social interactions. Sawa. But there are some places that things are not there. Bila ulijifungia kwa nyumba yako, ukanunua chakula ukajaza kwa fridge, hiyo chakula yako ndio unakula. I don't know. Let us interact socially and improve our relationships. Get to know your neighbor. Habari ya jirani nzuri. Jirani anaendeleaje? Uko salama, sawa? Hata sisi tuko salama. Is it bad to say hi to a neighbor? Is it bad to interact? It's good to get to know you. Even your relationship with family members. Sometimes there are people who have relationships that are failing with family members. Let us try to improve them and make them work. Benefits of mental health, it creates a greater sense of calm and inner peace. When you have you are mentally healthy, and you have balanced yourself emotionally, you are productive, you have an inner peace, you feel like you relax, yes. You are not anxious, you are not tense. So, it improved moods, clearer thinking. When you are mentally okay or healthy, you will think clearly. Your head is not full of maybe issues. There is because zinajaza kichwa. So you can think clearly, you can reason clearly. Mental health is all about the way you feel, your emotions, and the way you think, and the way you behave. Coping with the stresses of life. When your mental health is stable, then you are in a position to balance and cope with the stresses of life. Stresses of life is equal. Umetulia tu, and somebody decides you now steal your phone. So I'm going to get stressed. Hello, you're at peace. You're in the right place, doing the right thing. But somebody just wakes up and goes and leaves their phone. Then I'm going to get stressed. Si utakasirika a few days, a few minutes, then look for your small phone. You can cope with that. Sinarudi kwa kabambe. And you all wonder why nowadays kwa kabambe. Si maisha imezidi, tunamsengenya kidogo, atatumia kabambe for a month or two, alafu kitu itamwambia enda kwa ile ya kukopesha, anachukua hiyo, si ndio? So you are coping with the stresses of life. Anachukua hiyo, anasukuma nayo, anakasa all the thieves, alafu anasonga na maisha. You are moving on. When you are mentally healthy, you can cope with the stresses of life. But when your mental state is interfering, simu itakuwa for the next 6 months, you are still mourning your phone that way. You are still singing. Nilikuwa na simu, mtu akiingia, nilikuwa na phone moja mzuri, nilikuwa nayo imeibiwa, but we have to. Serious. I had a phone. I'm telling you, I had a phone. But for now, you have a phone. I tell you something in moja. Bila walifanyia. You see, things are passing you. Life is going on. Somebody wanted you for simu. There was something you are missing. There was something you used to do with this phone. Now you are missing out on it. Because you are still marked as there, will give you a phone. But it is very painful to give you a. Hata ukute maybe hadi ya 1,000 shilling kwa mfuko hivi. You are planned hivi, nimetoboa. Pia 1,000 nimetoboa. Then suddenly it is not there. You know your week is going to be bleak. Sasa utafanya nini? You have to rethink, to cope. Waliiba kweli kwa matatu. Hata nikajaribu kwamba hizi matatu naangalia unakumbuka hizi kwa matatu gani. Unaweza spend a day or two looking at matatu. But ukimaliza mwisho yake itatoa. Sio? Yote tunayofanya kwa matatu. But to show it has gone, accept it has gone, cope with the stresses of life. Yes. You can lose a loved one. You don't refuse. Loved ones never lose. Accept. Then have the good memories. Nani aliaga, alinifikisha college. Sasa nimebaki na 3 tafanyaje term 3? Ile brother mwingine anasumbua, lakini sasa ndarudi hivi. Now you come back very humble, unapangia nyuma ya nyumba yake, sivyo? Anakulipia term 3, tunamaliza term 3. Si umeko? Ama ukikuaje? One way or another you have to go. If you are mentally sawa. So what are our roles in the community? We come from community. Tunatoka community. You know what a community is? What is a community? Nasema Nyanenda community, Wabunga community, sijui Manyata community, Milimani community. What is a community? A community, yes.
A community is a group of people living together.
Somebody ongezea a group of people living together. Very true. Stop up. A group of people living together.
A group of people living together, the same goals.
Sharing the same goals, sharing the same amenities, mnashare hospitali moja, mahali pa kwenda mtoni, mnashare moja. Kama mmoja maji ni chafu kwake ama maji ni kikatu, zinakatwa kwa watu wote. You share the same amenities. Schools, your children or your friends or your brothers go to the same schools when you live in a community. See? And you don't have to speak the same language. Eh? When you live in one community, it's not necessary that you speak the same language, but you share, you live in a geographical area and you share the same amenities. So your role in the community that you live in is understand and identify the common mental health conditions in the community. We talked of the signs and symptoms, didn't we? We saw the signs and symptoms. So you should be able to identify and understand the common mental health conditions in the community. Our community, maybe community A has a lot of substance use. Maybe community B, there's a lot of depression issues. You don't have to have the same challenges in different communities. Or you might have all those conditions, but they vary. Understand the risk factors, so triggers of mental illness. We read the risk factors. We remember. So we should be able to understand it. The risk factors, things that predispose people to mental health conditions. We should be able to understand the things that predispose people to mental health conditions. Recognize the signs and symptoms of mental illness and refer appropriately. When you recognize, and I say, and I'm repeating, let us not diagnose people. Let us not say, nimetuma mtu wa depression. Umetuma wapi mtu wa depression? Elezea rafiki yako, nimeona vile unaelekea kuna hizi challenges, sivyo? So nilikuwa naomba, inawezekana kwa my Kiswahili is not very good but I'm struggling. Inawezekana uende hospitali uzungumze na mtaalamu, sivyo? This is a nice way of referring. Ama hata tunaweza andamana, hata mimi nilikuwa najihisi niko na shida. So labda tunaweza andamana, sivyo? So you have to refer appropriately to the institutions that you say you are referring. But don't you ever dare say, nimeona uko na, nimekuangalia nimeona anxiety. Sasa nataka kwenda. Alafu kufika huko, unaambia daktari huyu hapa na anxiety. Please don't. Because the mental health diagnosis stick. They stick. When I say malaria is transit, mtu anakuwa na malaria leo, kesho ana malaria na anaendelea na maisha. When you put a mental health diagnosis on me, it's supposed to be put by a specialized person. That diagnosis, if I commit a crime, it will always pop up. One. That diagnosis will always pop up. So who said you had depression? And niliambiwa kuna mtu alisomea mental health and aliniambia don't. Sawa. I'm stressing. Just see those signs and recommend an appropriate referral. Let the specialists do their work, do the assessments, and come up with a diagnosis. But yours in the community is to recommend appropriate referral. Now that you have seen the signs and symptoms, you can nicely and gently, after creating rapport, and you have learned communication skills, advise your friend that I'm taking my baby to the clinic. Can you go along? You're also taking yours. And when you're there, is it possible, those things that you told me, can you talk to this doctor over those issues? So you create your own nice rapport way of going with your friend along, or the community person. Or you can also refer to level 1. Who is level 1? We know our level 1s. CHPs. We have CHPs wherever we come from. I work in communities. We have CHPs. We know our CHPs. Do we interact with our CHPs? Can we go and link up with our CHPs and remind our CHPs that we have undergone this training and we are part of the team. We want to work together. Is it possible?
Yes.
Is it possible?
Yes.
So can you go and get to know your CHP? Because CHP is level 1. Dispensary level, health center, and so on. So you can make up also with that safety. If you have identified those symptoms, then you can CHP after identifying yourself in the CHP, showing your certificate that you get here. Anyway, CHP by certificate and the rest are training, and I want to work with you serious, especially on issues mental health. And what is my work? My work, nikiidentify hii itakuwa na kuletea CHP na MOH 100, which is a referral sheet. I don't go to the client, but institution. Is that okay? Yes. So get to know your CHP. Identify factors influencing the progression of the disease. Another one of your role is to identify factors. That is influencing the progression. Some of the factors can be some of the factors, substance use. So what do we do about the three factors? Can we share about income? Can we bring our friends along here when we come? They learn skill. Whatever the terms and conditions that are involved here, you can take them to do and then tell them that from the way I know you, don't people like to be praised? From the way I know you, tukienda huko na ukasomea hii kazi, and the way you know how to market, you will be someone. Very wrong. You bring them along, they learn a skill, they come back to the community, and they apply that skill. They will add value. So, if you see that factors that are influencing, you can advise your friends. I know it's good to be a dad, I know it's good to be a mom, but let us have them in moderation by choice. Currently, I have 4 nieces. Let us go and share with the healthcare provider or share with the CHP. Take a break at 4, and then make a step. We are not saying stop having babies. People will say, "Why you planning for stopping having babies?" It's not stopping having babies. It's taking a break, a deep breath, and then, as things balance, then you continue with the journey of being a parent. Who would want to have children that are not being well taken care of? Nobody, because you'll be perpetuating mental health illnesses. So we can have them in moderation when we are ready to have them. That's how. Our role, creating mental health awareness. Creating mental health awareness. I don't know how we do it in the community. Like this t-shirt is one of them, but we put on our t-shirts every day. So how will we do it? How will we create awareness? Those are the to-dos. When I live here, Jane, Anyango, Jim, I will create awareness. How? By being a change agent. Kwanza wewe, kama ulikuwa mwenye anapitia huko kwa substance, you stop going there. So when you create awareness that appearance is not another awareness, when you go to church, we go to churches, we go to mosques, we go to airports. Can you ask for 5 minutes to talk about mental health? Just 5 minutes. And in that 5 minutes, that's mental health is real, mental health issues are real, mental health problems are real, and there's kunatumaini. Just 5 minutes. And you leave them. When you tell them to come and see you, is it possible? Is it possible that tutoe ushuhuda. We really don't have anything much to say. Hata kama sina kitu ya kusema, niseme mambo ya mental health kidogo. And pia I want to just tell our community there is this issue that mental health things are happening in our country. We see what before. There are things that are okay, and there is hope. Let's go to health institutions and their system. But if anybody has a question, I am here. And we will walk together. Is that possible? Yes. Well, you can just a small, don't tell me what somehow. Let's take a short time. If you ask me to make a speech, even in your own family, you can go back home and tell your brothers and sisters, I've seen the light as far as mental health issues are concerned, and I'm creating awareness that this is what is happening in the world of mental health. Is it possible? Yes. Can we go and do it? Yes. When we meet somebody who is what is done, please, we don't see what is done. And we have addressing the needs and misconceptions. Issues mental health all along what I said as are myths and misconceptions. Ukiwa unatumia substance, walitumia wewe kujenga boma. Wanasema hivi. Walitumia huyu ndugu yako kujenga, waliona is very right. Alafu wakatumia yeye kujenga boma. Walitumia serikali waliokuwa na mchanga ya ndugu yake akitembea. Umesikia hiyo? That's true. It is true that when we were young, we used to be told if somebody has epilepsy, epilepsy is one of the neurological diseases. Actually, and what happens? So what you do that you have the longest route to your home. Waifanye mbali, lakini kitu nimekuambia na mimi siamka hapa akafanya hiyo maneno. So you take the longest route. And is it true? No. That is not how we get it. What we do is people again, myths and misconceptions. And that means where you come from. How much did I talk about? They are serious. So we can say that if you relate to people with mental health conditions, wewe mwenyewe utakuwa wazimu. Have you heard those? Is it true? You don't know? I've been living there for days, for 20 years. If I walk in the streets there, will you see any symptom of mental ill? I'm balanced, I'm a mother, I'm struggling with balance. So it's not written on the face. If you relate with them, you're relating with them with the aim of assisting. Yes, so let us relate with them. Let us not leave them alone. People who are alone is when they feel lonely, they feel discriminated, they feel they're not being taken care of. And everybody wants to be taken care of in this society. Support vulnerable persons, e.g. bereaved caregivers, offers. Support bereaved persons. Bereavement is there. It can come in different forms. But the pain people go through is not the pain of losing the loved one. The ones that are taught to be person, it always comes from society, from the community. The things you say after that it has happened. If it is women, she has been that. Do we forgive the women? Since you say, what are women? In my place where I come from, innocently, I told you, that one, why would they kill it with the breadwinner? Nobody stops to ask, serious. When people go through the treatment, household properties, inataka hiyo shamba sasa unataka ndogo, hiyo shamba unataka ile mali. Those are the things that bring them down. It's not the bereavement. The bereavement is there. Hata the chance that pia ameaga, hata mimi siku moja nifanya nini? But mimi kama hiyo siku ijafika, I have children to take to school. Kama siku ijafika, I have to put ugali on the table. Kama ijafika, kulikuwa na mikono mbili zinaleta. Sasa imebaki mkono mmoja. Kama ijafika, give them space. Yeah. So are we going to change our culture and support valuable persons? With the belief that when you bring offers to your home, watachukua baraka zote. Ambayo wewe unataka is it true? Do you believe that? I just need to believe. Those are the things that bring them down. Those are the things that create mental health illness to someone who has been believed. They believe medicine. Si anataka kabisa ya wana wao wakiana. Si anaona habari zisizo za barabara. Anaona leo ilikuwa but now after it has all happened, society is still nani anakimbia na hizo? Nani anakimbia na hizo? Are you helping or causing trauma? As if zilikuwa za ndugu yangu. Na yeye alikuwa nani wa ndugu yangu? So the trauma is not brought by the death. We are upset that death is there. But we feel pain from the way or mental illnesses come, the way now the situation is being handled. So let us be able to support vulnerable persons. Caregivers, people who take our mental health. It's not careful or to take a feeling like the caregiver feeling. Amekuja amekuwa vizuri hata anakupatia dada. Caregiver kulala usiku. Akimtafuta the whole day. Kumbe yeye alienda akaingia tu kwenye moja ya mtu na akalala. Hata akakula chakula yote na akalala. Sio? Na wewe unashindwa. Sasa mtoto ameenda wapi? Now my daughter will see what the people are finding here. You are not going to go the whole village looking for her. By the time you find her in the east, it's exhausting. Sasa kuna haya kuenda hospitali kwa sababu shida yake ndio anajua amepewa shida. Yale ni zote. Na umetembea the area kwa hiyo leta really that's sio. Yes, I know. Na amevaa nguo. Wewe unafikiria nikivaa nikienda kufanya hili na atatoka tena. Na sina kwenda mbele. Sasa ile shida yake. Sasa wakikuja mimi siangalia. Mimi siangalia. Bora. Hiyo is haya. So can you support the elders? When they have people with mental illness, can we stop the hospital? Who are the hospitals? Yes, you see them. We are the same ones. Don't think the person is feeling well when you say something about the person. And the things that the mental needs affect you are not things. Ulikuwa naruka gorogoro moja, amechukua mchanga, akachanganya ndani. Amechukua kibiriti, amewasha nyumba. Building a house is expensive. Amewasha nyumba. For whatever reasons. Sisi ndio tunasema hata nifanye nini? We have a lot of things to say. This about kama alichukua unga akachanganya na mahindi na mchanga. This is how unga. You know at the back of your mind the problems are, but you don't come to say, we need to talk about the mwambie hawadoni. Roho inasikia nikuletea mahindi kuna gorogoro wako. Ukikwambia unaenda hasara. Support the outside. Sawa. Just give them the support that they need. If you know of a place you can advise them to go, advise them. If you know of an organization that supports them, direct her in that direction. Sawa. Let us not judge. Let us not. Let us not. Let us not. Because we don't know about tomorrow. Or do we know about tomorrow? Do we know about tomorrow? So let us not judge. Ukiona kama ameelewa, and you have an extra attitude, mwambie pia nilikuwa naenda sokoni utakuta what I would say, nilikuwa naenda kutafuta viatu sasa, si naweza kununua nayo, but believe me, I was going for shoes. You just need to keep her, and because you want to keep her limit, unamwambia watu nipatie hii, uongeze kwa viatu mengi. Sasa ninaona nimetoka, wacha nirudi, nimepigiwa simu nyingi, sinapatia ni in a nice way. You create your own, if you are creating a relationship, then you have a way of handling it. Sawa. Caregiver. The caregiver also anago alone. Mpaka anaweza break because of the mentally ill. Mentally ill sasa yeye ashara. Caregiver pia msaidie. Sawa. Monitoring adherence to mental health treatment. Monitoring adherence to mental health treatment is also part of our responsibility. If you know a friend or someone in the community is using mental health drugs, and you know that the drugs are helping them, and you take it upon yourself, you can always go, nilikuwa napitia, utafanya vile, you know how you create a relationship with this person, because you know, akiweza dawa, huwa anaenda kazini, akiweza dawa, anatunza familia yake, sio? Akiweza dawa, anakuwa productive. Akiweza dawa, anaweza kuwa fruitful. So you take it upon yourself, and even if it is your sister, kila siku saa 3 usiku, just saying hello. Now that she knows that she's open up to you, that she's taking medication. See if I call agenda. Maybe. Sasa, umeweza dawa kweli? Asijameza. Afanya hivyo. Sawa. Ayabarikiwe. Sio? How much imekosa wewe sana? And when she's okay, she's taking care of her family. When she breaks, that family will come to you. Sasa itakuwa ni responsibility yako. Si akadmitiwa. Watoto wataenda wapi? Na ni watoto wa dada yako. Na wanakufanana. Wataenda wapi? Na wataenda yako. Sio? So when you monitor adherence to mental health treatments, kliniki yake ikifika, remind her. Na kama anaweza kujipeleka, that's what you do life efficiency. Mwambie nimeomba mtu pikipiki, leo ni mimi na wewe na pikipiki. Fanya nini? Sawa. Offering mental health first aid is not of the first aid. So you can offer the first aid, mental health promotion. These are activities offered to individuals, groups, or large populations to enhance competence, self-esteem, and assess the well-being. Sawa. Specific ways to mental health, to promote mental health. There are ways, a number of ways to promote mental health. Good nutrition. From the word go, there is need for good nutrition. Even when the women are pregnant, the story of mental health starts with the pregnant mama so that she can have a wedding baby. Stay positive. Strive to stay positive. Be a positive environment. Helping others, getting enough sleep, and engaging physical activity. Connecting with others, developing coping skills, getting professional help if you need it, maintaining maternal mental health by offering psychosocial support during pregnancy and coping skills, supporting safe environments. When ladies are pregnant, maternal mental health is important, and the book Road to Health, we look at page 8 and page 20, it's talking of maternal mental health. So it means maternal mental health is important. When we see these young girls having babies and bringing the baby, let us not be judgmental. Let us take understand the story. Nobody has to wait the dad. All they do is beat up the young girl who has thrown the baby. Who carries a patient to throw that baby? There is a story. Society has been harsh to the girls. They beat them, especially the ladies. You are not going to say and they don't ask what is Can you imagine how scared she is? She's scared to be a mother at 15. It's very scary. If a mother at 30 anachoka tu, a mother at 15 nafikiri anasikia 15. She's a baby, she has not even grown up. So supporting safe environments, make our environment safe. Reduction of stigma and discrimination. Talk openly about mental health as we are doing now, we are increasing stigma. See, all of us here can now talk about mental health. So if we are 30 people, how many 30 pounds are going to talk about mental health? It's a good number. And then we form a pyramid. We talk to 2, we talk to 3. So we talk already about mental health, such as sharing on the media platforms, through social media, educate yourself and others, dispel myths and misconceptions, or negative comments by sharing facts and experiences. Remove those negative comments. And you know the comments you make. I usually feel very bad when I go to a scene and a young girl is 16 and I keep uploading. And I get the comments. I usually want to put a number because we don't need to comment. Keep your comment to yourself. If you can help retrieve your daughter, help retrieve your daughter, keep quiet, do what you can. Kama unaweza kupatia nasema wewe unapeleka mtoto hospitali. Mimi nimetoa hiyo 100 yangu ya transport and go your way. Please don't talk about that. You don't know her story. You don't know her story. You don't know her story. So let us not talk about stories we don't know. First up, 16. You don't know her story. So let us educate ourselves and the others, and we share the facts and experiences. Be conscious of your language when you talk to mental kids, or when you talk about them. Be conscious of your language, the languages we use. See, we have a lot of harsh languages for such people. Let us be conscious of our language. Remind people that words matter. The words that you say to somebody matters, and they will carry them forward. Show compassion for those with mental illness. Can we show them compassion? It's not their making. Be honest about treatment. Normalize mental health treatment just like any other care treatment. When people have mental health issues, even in the institutions that you are, So let us remove the self-esteem. Let us encourage them. Ameze dawa yake hata kama anaweza karibu na wewe sisi yetu. Sio? Let us encourage them. Is that possible? Even in class, kama yake ni kumeza saa 3. Mbona kumeza mnasema ni sawa, mnafikiana alafu mnasema nyingine mnaweza sasa. Akicheza kwa field, arudi kidogo asama sorry, atunaona vibana ya. Is it fair? Is it fair? Are we going to let them be? Are we going to normalize mental health treatment? Akikwambia anipatie pesa, leo ni siku yangu ya siri, niende nione daktari wangu. Kama ni mtoto wako, usijifiche sasa ni siri ama ni brother yako, siri. You can even escort your brother or your friend to the clinic, okay? Just like other health care treatment. Let the media know with the language, representing stories related to mental illness. Die by suicide. Committed suicide. Sasa utaikommit aje na uchafu. Such wordings. Sio. Let the wordings be favorable. Choose empowerment over shame. Let us not be ashamed. Let us empower ourselves. And let us empower people with mental illness. And let us also be empowered. Let us not be ashamed of our mental illness. If you have a relative with mental illness, don't be ashamed. Empower them. somebody called back and say, I fight stigma by choosing to live an empowered life. To me, that means owning my life and my story, and refusing to allow others to dictate how I view myself or how I feel about myself. He was responding on Facebook to the question, how do you fight stigma? Self-care activities. So you encourage self-care activities. Suggest actions that the person can perform, him or herself, that can help relieve the symptoms of mental disorders, such as getting enough sleep, eating a healthy diet, regular exercise, relaxation and breathing exercises, taking a walk, meditation, avoiding alcohol, joining support groups for women, men, or youth, chama groups, etc. Somebody read that for me.
There is no health without mental health.
Is it true?
Yes.
Which Elan? Which Elan? See, the head is the person. If you're not mentally okay, and you have a physical ailment, you end hospital. If you're not mentally okay, and your family has a problem, there's a social, economic problem, will you solve it? So we need to be mentally okay. So you cannot have health without mental health, because nobody will take the instructions you're giving. So let us help people to be mentally okay. Sawa sawa. Let us hold their hands. Anybody with a question, a concern, or a worry, or anything to add on, or anybody who feels like challenging this, that there is help outside mental health. Anybody who wants to challenge that? There is no health without physical health. Is it true? Physical. Physical, if we say physical, so you can be physical challenge. But you're moving around. You have an amputee. But you're okay. Why? Because mentally you are running your family. You can socially have social challenges. Just you go around, but because your mental state is clear, sina pesa, lakini kama nitoke hapa niende nikirudi hivi ile nianza kulipa nitarudi kubaya, sio? Because your mental state is okay. So you can solve the physical and the social. But if your mental state is not okay, utaweza kweli? So there is no health without mental health. So this journey you have started is a beautiful journey to help our community. Sawa. So tusirudi nyuma. Sawa. Yes. And if you feel sometimes when you walk the journey with mentally ill people, sometimes they can bring you down here. Because unaona shida za watu mpaka unauliza, yani hiyo yote ni shida mtu hapo nayo. Sasa unarudi kushangaa tena. So you are now not adding value, you are now becoming part of the video. You can always call, you can come back when you are hapa for the briefing. What is the briefing? Serious. We can call a session, come together and share and support each other. You give your experience, you give your experience, you have different personalities, you can understand different things, different things, and we give each other support, psychological support. I'm grateful you are patient, you listened. If there is no question, as I said,
even though tunapenda, I feel light. I don't know how you people feel. Kumbe mimi ndio nilikuwa mentally hapa. I feel very light. And that's why if somebody saw me, I was very focused. Hata mtu akiniongelesha nilikosa kusikia because nimesikia, thank you madam. I feel offload something. Who feels like light and bright, ready to talk about it? I'm always in the church and I never feel like talking about it. And thank you for giving me this confidence. So I'll be sharing about it every time, because sometimes we get forums and we don't maximize
Sasa, so before we give them a good hearty clap, and somebody should be preparing to do this, I want to call the coordinator to come and give us a few remarks. Then somebody will come and help us flower them. I don't know if it's flowering or clapping, the way you direct us. Then immediately after, we do a ceremony. Senior? And thank you for being good students.
Thank you so much, Madam Pamela. Good afternoon. Please continue your list of prayer. Not just continue. Yes. Okay. Madam will decide whether we are continuing now or some other time. But for now, I'm happy that this session has impacted you with knowledge, it has empowered you with information, and you can now stand in front of people and convince them that I can tell this person needs help. I can tell that this person has a problem and they need to be seen somewhere, isn't it? Yes, can we clap for ourselves? That is great. One thing you need to be aware of is that mental illnesses are more common than you think. They are very common. And since it's something that we have not normalized to talk about, people don't realize how common they are. So we now need to talk about it. And when you talk about it, you will realize how people come up. They now start opening up, now talking about it, and they will now start raising their hands and telling you, oh, I have been feeling this way, my sister has been behaving this way, my boyfriend has been behaving this way, my mother has been irritable, my father has been drinking a lot, and you realize that people are now opening up because we are talking about it more often. So let us talk about it. Let us empower others. The way you have been empowered today, let us do it further to other people. Because there is no health without mental health, isn't it? Yes. If you're not healthy, yeah, how will you be healthy elsewhere? No way. No health without mental health. We all have to agree so that you are now healthy. Sawa. Yes, if one stone, you remember you were taught about the 3 stones. Yes, if one is missing, then it means you are not fine. And there is data that says 1 in every 4. 1 in every 4 has a problem. Yeah. So it is very common. It's very common, and until someone you know, until you have a relative, until you have a sibling, until you have a child who lives with a mental illness, you may never realize how important, how a burden it is to the community and to the country. So after this training, let it change how we look at mental health. Let it change how we look at the community, and let our eyes be more open to be helpful and to be very supportive. Isn't it? Yes. Let us stop labeling. Najua hakuna kitu imeandikwa hapa, but when I start talking and expressing myself, saying, you know, I've not been sleeping well, you know, I've been drinking too much, you know, I've been risking myself, my behaviors, until we start saying that, you cannot just look at me, because it is never written here. You cannot just look at me and tell that I have a problem. But until we start talking about them, we now can tell this has a problem and it needs to be supported. Let us be very supportive, accommodative with UPR. You know what UPR is? Unconditional positive regard, being non-judgmental. Unconditional positive regard. Many times we judge people. Someone stands in front of you and before they even say a lot, you have already judged them. Huyu wachana hata hizo story zote sijui nini. Unconditional positive regard, you don't judge. What you do, you listen. And when you're going out there, nimekuwa na kalamu nimechora. Masikio zako zinafaa kuwa round hivi. Unaona kwenye unapitia huko kwa roof. Yani very big ears. Very big ears. Because what you do most is to listen. Not to talk. Telling people what to do. No. Yours is to listen more. And the eyes are also there so that you can observe. But the mouth is very heavy. Because you should say very little. So listen more, observe more, and say very little. So that you don't just judge. Unconditional positive regard. Whatever they say, don't now start blaming people unajua sikizi au msikizi maneno unakunywa sana, unavuta bangi sana. Don't judge them. You don't know their story. You don't know their story. So listen, observe so that you can now start seeing getting into their story. Sawa? Yes. Don't forget the big ears, the big eye, and the tiny mouth. Yes. And unconditional positive regard. I think with that, I can get back to Madam Pamela. Thank you. Before I do that, I want you to take my sincere apologies. I came in very late. I had wished to tell you early enough. And it's because today on Wednesdays is when we run our psychiatric clinic at the county hospital. So you see, when we say a clinic, it is a scheduled appointment. You put people on a schedule and you have to be there to see them. So when this event came, we could not, there was no one to delegate that assignment to, and so I had to see the patients so that I can accept my apologies. Thank you so much for being here, madam, and thank you so much for squeezing the time. You were not blank, she was here, she has done some very good work, and I know you are very busy people and see that for this county. So, can somebody come and do this better for me? Who was coming? Eric, Madam, we want to pour our hearts. We don't know how to tell our facilitators, but I think what Mambo is coming to do will help us be near.
Good afternoon, everyone. Good afternoon once again. I think, as Madam said, she's lighter, but me, I would say I'm enlightened. Ask me why. You know, I came here in the morning with a very bad pain, and I'm finding about the funny news. And it's like God wanted me to be arrested here. And she just arrested me to my answer. And Madam Pamela also there to answer. And I'm looking at her and said, you I came here with a very bad issue, and there are people who wanted to go away out of this school. completely. Because my mental hyper, I've gone hyper. And I have the names inside my book now. And you know what? I'm even folded the Karakasi now. I've kept it. Because I know there is people, there's something they need more than what I want to do. Because if I would have sent them away back to that community that does not understand who they are, what they want, and what they're supposed to do, then I would have been creating a very big problem again. So I have learned that when they come, one by one, I will deal with them. No, not negatively. Not that I'm angry with you. Because from the look of what I've had here, and the way I've been seeing them and the way they've been behaving, these people have some mental issues that need to be handled. And maybe my approach would have even worsened the situation. Because you talk to them, you look at them, these are matters, mature people, they know they're supposed to be doing. Why are they doing this? Can they be the ones who are training these ones that are very young? So I came very bad and tell you, God has said and we have said and I believe this day was meant for us. And maybe God wanted also to use some examples. So now we are very thankful, especially I want to start with the management of Kisumu YMCA. It is a noble, prudent, and a very good idea to take such a thing for us, young people, and even us who are disciplined. And we humbly request that it will come once and once again, so that we are refreshed, divided, and renewed every day. I want to thank our facilitator. Mama, you really done us a very good job. Who enjoyed the talk? We come back your girl. She was talking like her mother. See you. She was so much of a training. Who said that? Is it me or somebody else? She was so much of a mother to us. Even her talks was so much. In fact, I'm not seeing anybody sleeping. These young people are not left. We only need one energizer. Now from Sadatu, we can put out a voice. And they were not on the phone. Yes, and not on the phone. Now, they are just out loud. Please come and join us. Thank you so much. You are uploaded for us. I pray that the God we serve at Kisumu YMCA will load you more for other people, so that you don't remain empty for another generation that needs you. Our coordinator, thank you so much for taking the time, and we want to pray that God will give you more grace, because you say you handle people with pscychosis issues. I can't imagine what you face from morning up to the time you came here, and still you saw it better to come and also deal with people like us. Because we also have mental issues that we have now gotten through. So thank you for taking the time, and I pray that God will give you more grace, so that you're able to take care of more other people that also need you. I know you also have to do a lot, but without we say here, you are doctors, but you're all human beings. So all you need is God's grace to keep you going. And for all the young people that are inside here, I want to thank you for taking your time, being attentive, and I would want to tell you this. If there is one thing you should be doing today, go back into your houses and thank God for this opportunity. Because it was not for everybody. And I always tell young people, when you're chosen for something, you're not so special. It means God has seen something in you. And when God brings something, it means you that was chosen, you have been given a mandate. God has sent you now. It's not about YMCA, not about Father Pamela. It is God who is sending you today. Because that God has watched those people. And He has seen there are no people He can send to go to them. So you are chosen. You are the Moses. Can you go? And if you need a Joshua, God will give. Praise God. So I appreciate and I want to thank you so much. And I know we are going to do something back into the community. Let us not keep the certificates and go with them and add on our CVs, but we are not going to them. You will not be accountable to YMCA. You will be accountable to the God who gave you this opportunity. Because if you fear God, this one will be easy for you to take it back to the community. But if you say you will fear Madam Pamela will be there. So she wants to serve you, she wants to see you, but there's one person who gave you this opportunity. You are accountable to him. Praise God. So we also want to thank our God Almighty for allowing us to see this day, making it a success, ensuring that we are able to be here healthy today and alive to see this day work. We give him glory and honor because it's a good God. See there? I want us to stand up and give with a good clap. So because of what you see in inclusivity, see there? I want us to start with that. Nani more want to clap hivyo? Because we don't assume we don't have them here. They are here. See there? They are here, so we start with that. Let us shake it. Let us make sure they also know that we appreciate that we are also among the community, and we are using this opportunity to thank our facilitators and institution for them. And then 1, 2, 3, 4, let's give it a clap. We do it again. Let's clap, let's appreciate our facilitator. The last one I want you to face them. So our facilitator, the management, and then let's go to the facilitators and the management. 1, 2, 3. We now go back to ourselves. Let's clap for ourselves. Give it a shake. That's it. And then clap for yourself. I thought you was your clap even better. Okay, let's go now. Let's go. We now give it to Madam Pamela. Is that right? Yes. Let's give it a clap. So 1, 2, 3.
Thank you so much, Madam. She has done it well. So before we get certificates, that was your meeting was here. Before we get the certificates, we need to create awareness. We need to create awareness. We have accepted that we are going to the community, and the community look at us differently. We are changed agents inside here. Sindio? So tutoke mtu ashindwe, najua Madam Pamela siku hizi yaongei sana. Kumbe nimebadilishwa. Sawa? Hata wewe, let somebody look at you and ask themselves what is happening with you. Isn't it? But be a change agent in the community. Because we have to create the difference. Sawa? So I want to give you the task. If you get any forum, I'm here. Come and tell me, Madam, I want to go to this school and create awareness. Madam, I want to go to Migori and create awareness. I'm here, I'll facilitate you. I'm ready. I'm ready. I have all the numbers, I have all the names here. I'm just waiting to see in this group who is going to be achangamkia. Niko hapa. Sawa? I'm seeing there are some KMTC students. Pia wa ambassadors. Sawa? Tokeni hapa twende nje to spread the gospel of mental health. Mimi niko hapa nimejitolea. If you want facilitation, I will do it. Sawa? Yes. Otherwise, God bless you so much. So I want to go. And we are so privileged in the Madam Anasema. You know, getting these people is not easy. Yeah? It is not easy. So imagine you are privileged today to get a certificate na coordinator. Unamwona kwa siku ya kwanza. Hata sasa saa hii unajua unafaa umweleze atafute namba yake. So hata tukienda pale district kwa county, unagonga ukienda huko juu, si ndio? Na uanzi chini because now you are friends, si ndio? Tunafanya kazi pamoja. So na vile Mungu anafanya kazi. So be proud, So as you receive the certificate, you'll be giving you, so uliita jina yako, unachangamuka, unakuja, and then there's a last statement here that there is no health without mental health. That is the song we want to sing outside there, and somebody takes as a video with our certificates, so that the world knows. Even by being on social media and singing that song is creating awareness, isn't it? So to talk up where somebody will help us, will say there is no health without, and we'll be shouting, so that the world knows. Tuko pamoja? Yes. Mercy Goretti, Mary Goretti, Otieno. Mary Goretti. More
Doreen Shansu Makonga.
Sim club.
Mercy Chekemore. Clap the way we Vincent Kareji. And there's something that I forgot to say. The certificate has been signed by the MOH mwenyewe. So if you want your civil business, somebody will see the MOH and say, no, wow. Ministry of Health. Minister Kareji. Ruth Sophia Mambo. Priska Alwatch Masiaga. Shante Olisa Ogola. Sarah Mosoba Manira. Winnie Awina Uma. Tom Joram Amutete. Simon Leo Okondo. Silas Amoy Mbili. Alex Omondi Onyango. Adeline Bukasia. Shari Atieno Ayeko. Calvin Wisdom Otijo. Elizabeth Precious Gift Adhiambo. Emmanuel Otieno. Eric Swegeni. Jane Tina Atiki Okeo. Ishmael Meche Okeo. Isaac Iga. Fidel Castro. Ezekiel Michael Oche. And finally, Hadida. Kuna mtu hajapata certificate? Oh, mimi. So we have our certificates. Now we can get out. And before we get out, it is just good manners to do a course in prayer. So that tukimalizana nje ni tunaenda. So you should be talking to Fanny to help you get ubebe certificate vizuri. Sawa. Uongeleshe vizuri. So we can stand up. Then I ask what do you want? kuhojiwa hapo nje so that we also give feedback on the training. Sasa, at least one or two, I think kijana na msichana, or maybe 2 girls, 2 boys, so that we also get a feeling of you about the training. Can someone pray for us?
Let's pray. Our merciful and loving Father, thank you for giving for your provision. Thank you for the children of your Father and teaching your Father. As we go to our community, let us be a good example and let us decide what we have been taught today, your Father. Guide us through, be with us, protect us in Jesus' name. Amen.
Thank you. So today, now we're going to take a picture. Then we do the mental health. When there is no health without mental health. Then kijana mwahoji. This time sitaki kuwe sister tutakaikuwa hapa. Maybe later. Yeah, exactly. So let's finish up our shop.